workplace. It is a subject that needs urgent attention. Mental health is not just about individual well-being. It is a critical factor that influences productivity, organizational success, and overall economic health. In fact, poor mental health at workplace can lead to absenteeism, reduced engagement, and even burnout, all of which directly affect the organization's productivity and performance. Research suggests that globally, depression and anxiety alone accounts for more than 1 trillion of staggering loss in productivity. Closer to home, many Indian workers, especially in the informal sector, are more vulnerable due to lack of mental health support in their work environments. Harassment, discrimination, long working hours, and stress are common, yet mental health resources remain scarce for this section of the society. Creating mental healthy workplaces is not just a moral responsibility, but a strategic imperative. The Government of India has recognized this and has been actively formulating policies and launching programs aimed at building a resilient ecosystem that supports mental well-being across all levels of society, including the workplaces. To address the increasing mental health challenges, Government of India has undertaken several key initiatives. One of the foundation efforts was the introduction of the National Mental Health Policy in 2014, which established a comprehensive framework to integrate mental health services into the general healthcare system. This policy emphasizes equity, access, and quality of mental health care for all the citizens. Building on this, the Mental Health Care Act of 2017 was a landmark step towards ensuring that every individual has the right to access mental health care. The Act adopted a rights-based approach aiming to destigmatize mental health issues and ensuring that those who suffer from mental illness receive treatment with dignity. It also outlined a framework for providing mental health services at primary, secondary, and tertiary levels, thus ensuring access at every level of the healthcare system. The district mental health program under the National Mental Health Program has been crucial in making mental health services available at the grassroots level. Today, 767 district mental health units are operational across the country, providing both outpatient and inpatient services. These units are staffed with qualified mental health professionals who offer treatment to a wide range of mental health conditions, from depression and anxiety to severe disorders like schizophrenia and bipolar disorder. Furthermore, through the Ayushman Bharat initiative, mental health services have been integrated into the Ayushman Arogya Mandirs, which provide care for common and severe mental health conditions. These centers are essential for offering mental health services at the community level, making support more accessible to people in remote and underserved areas. While these initiatives laid a strong foundation, a crucial part of today's discussion is how Tele-MANAS has revolutionized mental health care delivery in India. Launched on October 10, 2022, Tele-MANAS is an innovative digital mental health program aimed at reaching the unreached. This initiative was designed to be the digital arm of the National Mental Health Program, providing 24/7 services to 24/7 mental health services, especially for individuals in the remote and underserved areas of the country. In the 2 years since its inception, Tele-MANAS has handled more than 14 lakh calls, providing support in 20 different languages through 53 Tele-MANAS centers across 36 states of the country. This has made mental health care accessible to people across India, ensuring that no one is left behind due to geographical or financial considerations. Today, we are taking the Tele-MANAS a step further by launching the Tele-MANAS app and video calling feature. These new tools will make mental health support even more accessible. The app provides users with an interactive health platform where they can access mindfulness exercises, mental health tips, and even games designed to promote well-being. More importantly, the app will offer confidential mental health support anytime, anywhere. The video calling feature is another important upgrade, allowing mental health professionals to conduct more thorough assessments through video consultations. The feature, launching today in Karnataka, Jammu and Kashmir, will be rolled out across the country shortly. It is expected that it will greatly enhance the quality of care provided through enable brief physical and mental state examinations. Coming back to today's theme, it is important to note that workplace mental health is not just about addressing the mental health needs of the employees after problems arise. It's about building resilient, supportive work environment that proactively promotes well-being and prevent mental health issues. This requires a multi-pronged approach, which includes creating policies and frameworks that foster mental health resilience, ensure mental health support in informal workplaces, which often lack structured healthcare systems, and promoting holistic practices such as yoga and meditation as preventive strategies for maintaining mental well-being. In this context, India is uniquely positioned to lead the way. Our rich tradition of holistic healthcare practices like yoga and meditation can play a pivotal role in promoting mental health at both formal and informal workplaces. Today, we will hear from experts across fields about how these practices, along with structured policies, can be integrated into our workplaces to foster a mentally healthy workforce. I'm also excited to share that today we will be releasing two important documents. The Tele-MANAS Rapid Assessment Report, developed in collaboration with the World Health Organization and NIMHANS, and the second document is the self-care booklet titled Taking Charge of Your Mental Health Because It Matters, which provides practical guidance on maintaining mental well-being, particularly in the workplace. In addition, today's event will feature roundtable discussions with experts from diverse sectors, including representatives from NIMHANS, AIMS, IBAS, WHO, FICCI, and CII. In conclusion, today's event is not just about celebrating achievements, but about charting the future course for mental health in India, particularly in our workplaces. As we move forward, it is crucial to embrace a multi-stakeholder approach involving governments, industries, civil societies, and healthcare professionals. This is to create work environments that prioritize mental health. Let us make today a turning point, one that fosters open dialogue, builds collaborative solutions, and ensure that every individual, regardless of where they work or live, has access to the mental health support that they deserve. I would like to thank all of you, and I look forward to the rich discussions and learning we have in store for today's discussions. Thank you.
Thank you, sir. I now invite Dr. Rodrigo H. Ofrin, WHO representative to India, to deliver his address.
Thank you very much. Ms. Aradhana Patnaik, our ASMD, Minister of Health and Family Welfare. Mr. Saurabh Jain, Joint Secretary, MOHFW, and Dr. Pratima Murthy, Director, NIMHANS. Good morning. We are here today to mark World Mental Health Day, to increase conversations and promote actions to support mental well-being for all. But first of all, a very big congratulations to the Tele-MANAS for huge achievements in just 2 years. This year's theme, Mental Health at Work, highlights the profound connection between mental well-being in the workplace. With 60% of the global population in work, addressing mental health in workplaces is not just an option, but an urgent necessity. Just think about it, we are at work more than 8 hours for many of us throughout the day. And it is usually the cause of our mental health stress, as you would say. In India, with its dynamic economy and a vast workforce of over 500 million people, mental health challenges in the workplace have emerged as a growing concern. Or maybe we are not detecting it as much as well. Fast-paced economic growth, high job insecurity, gender inequity, disrespectful workplaces, unsupportive colleagues, and physically challenging working environments are some factors that place significant stress on workers all over the world. Stressful or unsupportive workplaces can lead to negative mental health outcomes. For employees and contractors, long working hours, high-pressure environments, and lack of work-life balance are key stressors. India also has a large informal workforce where employees' lack of job security and stable incomes further exacerbate mental health vulnerabilities. All these factors raise the risks for anxiety, depression, and burnout. Workers, particularly those in the informal sector, often have little or no knowledge about mental health issues and lack of access to mental health care. Poor mental health also affects an employee's capacity to perform, leading to absenteeism, reduced productivity, or lower job satisfaction, all leading to poor productivity. Despite growing awareness, especially during COVID-19, when everyone experienced mental stress one way or the other, mental health stigma remains a significant barrier in all countries all over the world. Employees struggling with mental health problems often don't seek support, fearing discrimination or job loss, or even a renewal of contracts, preventing them from seeking help. Employers have a big responsibility, and I'm happy to hear that representatives of the private sector are also here. We must create supportive work environments for promoting mental health and well-being. Employees who feel supported are more likely to experience job satisfaction, stay engaged, and be productive. Sometimes these are not health interventions in the workplace, but actually our own HR and hiring policies. Creating such safe spaces at work involves raising awareness around mental health issues and training managers to address them, as well as implementing wellness programs at the workplace. For example, initiatives that offer employees regular mental health check-ins have been shown to reduce stress and increase engagement. In some places, it's just a peer counselor that is provided by the employers. In other places, there is already what we call a mental health leave. So it's not part of your sick leave, it's just for you to have a mental health break. For employees experiencing mental health issues, employers should offer reasonable accommodations such as adjusted workloads, flexible hours, or remote work options. This ensures that employees feel supported without sacrificing their mental health. For workers in the informal economy, policies that can provide mental health coverage and protection, such as access to health services or even Tele-MANAS, or stress management programs are essential. Investing in mental health services for these workers will not only improve well-being, but also enhance overall economic stability and productivity. Now towards Tele-MANAS. In India, Tele-MANAS, the online teleconsultation platform, has played a huge role in delivering health services and also breaking the stigma around mental health. A WHO review of Tele-MANAS has shown it to be a successful model for mental well-being and support, and can be transplanted, adapted in other countries as well. It has the potential to be utilized by more people in need and even expand in terms of referral to other mental health issues or other health services. For example, a person who is under stress, a simple question, and I've discussed this a lot with Dr. Pratima, you will also ask, how do you cope? More likely or not, someone will be using a substance, either alcohol or cigarettes. Then you can be referred again to tobacco cessation or alcohol cessation. So Tele-MANAS can be an entry point for other problems. And I congratulate MOHFW for 2 years of a very successful implementation of Tele-MANAS. We have seen it in the States. Adolescents are a very big demographic of users of Tele-MANAS, showing that there is really a need for us to continue and strengthen the Tele-MANAS services. Primary healthcare, especially Ayushman Arogya Mandirs, also has a role to address people's needs for mental health care and raise mental health awareness in the community. Synergies with primary healthcare services together with Tele-MANAS will really redound to huge achievements in improving mental health and well-being of the population. Of course, as WHO India will continue to extend all technical support to the ministry for any of these further expansions. Building resilient workplaces in India requires a collective effort from all stakeholders: employers, employees, governments, and mental health professionals. Together, we can create an environment where mental health is prioritized, stigma is reduced, and every employee has the opportunity to thrive. On this World Mental Health Day, let's recognize that the mental health of our workforce is the foundation for a healthier, more productive India. It's time for employers, policymakers, and individuals, as well as employees themselves as peers, as peer counselors, to commit to building workplaces that truly support mental well-being for a healthier future for all. Thank you. Dhanyavad.
Thank you, Dr. Offrin. I now invite Ms. Aradhana Patnaik, Additional Secretary and MD, National Health Mission, to deliver her inaugural address.
A very good morning to all of you. My greetings to all of you on World Mental Health Day. Dr. Rodrigo, WHO representative to India, Dr. Pratima, Director NIMHANS, my colleague Saurabh Jain, Joint Secretary in the Ministry of Health and Family Welfare, KK Tripathi, Economic Advisor, other representatives of Ministry of Health and Family Welfare, ED, NHSRC and his entire team, various development partners, organizations, ladies and gentlemen. A warm welcome to all of you on World Mental Health Day. I hope all of us sitting here are free from anxiety and tension. I'm correct? So let me start with a small story. So one person, an employee of an organization, it was a very reputed organization, used to have a very strict and very, temperamental boss. The term, khadus, which we say. So this khadus boss used to daily, harass this employee. He would complete his targets, but yet the boss would again give some additional work if he finished, before time, so that he would be required to stay late till night, and would try to find out, even small problems or even small mistakes. He would be given a firing, that you are not competent, you are not able to do. So all the definitions of a khadus boss was there in that person. And this person was a very docile, sincere, hard-working person, and slowly started getting depressed, and he then started taking it out on his wife at home, wife and his children at home. So now his life in office as well as in house also started becoming hell. Then suddenly one day he met one of his old college friends, school friends in fact, school friends, and somehow he bumped into him, and when they met, so this boy, when he was a boy, basically this man, when he was a student in college, was very jovial. So his friend noticed that this person has changed a lot. He looked very serious and very old, very dejected sort of. So he asked him. And this person narrated the entire story, how his khadus boss has been totally harassing him, and now it is coming on his family. Now he has regular fights with his wife, and also he keeps shouting on his children, and he feels very bad about it, that he cannot control it. So his friend gave him an idea, and he implemented that idea. So once he started implementing the idea, then after a few days, his behavior at home changed. He was as earlier, he started behaving well with his wife and his children, and there was no problem at home. Of course, the khadus boss continued with his behavior. So then his wife was quite surprised that पहले तो ऐसे इतना आके चिल्लाता था घर में, अब क्या हो गया अचानक. So his wife also thought कि पता नहीं कोई और लड़की मिल गई क्या, अब यहाँ पर आके मुझे कुछ परेशान नहीं करता है, कुछ ही नहीं कर रहा है, and he's very happy at home. Yeah, has he started drinking or gone into some bad habits due to which now at least in family there's no issue. So one day what she thought was, after he finished his office, she was there outside his office, and she followed him कि कहाँ जाता है ऑफिस के बाद, ये कहाँ जाता है, किसी जगह दारू पीने जाता है या किसी लड़की के यहाँ जाता है. So then he followed him, and she followed him, and then she saw he went near the office, around 5 kilometers away from the office, there was a jungle sort of, a place where the man went, and there was an effigy he had made of his boss there, and he took out his sandals, his shoes, and started hitting. And he would just, give out all the जो हम लोग कहते हैं ना typical गाली हिंदी में, जितनी भी प्रकार की गालियां हैं, वो पूरा उस पर निकाला, and he did it for half an hour. आधे घंटे तक उसको जितनी गाली दे सके, जितना दे सके, and जूते को बार बार मार के, फिर लाकर, फिर मार के, फिर करते करते करते, in half an hour, and then he was like happy, and then he went back home. So the moral of the story is we have to find solutions to our own problems. We should not escalate our problem. There's a solution to each problem, and I think this applies to all of us in the workplace who are working day, night, and because most of our, the day time we spend in office. So the productive time, the effective time of our entire, 24 hours, almost 8 to 10 hours in Ministry of Health and Family Welfare. I keep saying it's almost all of us spend more than 10 hours. So it is the crucial morning 9 to late night 9. It's almost 10 to 12 hours everyone spends, and if that is not as per our requirement, then somehow it has an impact on the entire daily affair, the night affair, and the entire family affair, the entire life of the person. So it is very essential that we have such, some such remedial courses for the people who still are in tension. We need to provide a good environment in the office. That is important. Work is important, but apart from work, you also have to keep yourself effectively engaged so that you give productive results. So this is for office, but also at home front also many times there are many people who have tension in office. So I remember there was another person who used to say कि we have a खड़ूस boss, and what they used to talk behind the person, ज़रूर आज घर में बीवी से लड़के आया होगा इसलिए यहाँ डांट रहा है सबको. So again, home front is also, one should not, take that out in the office, or the office tension should not go home. That is one thing which we say in work-life balance for all officers like us. I have been trying to, myself practice it for the last 25 years of my service, keeping work away from my home front. So that has really helped me balance both. The second, which I feel we need to now focus on, now today we are celebrating 2 years of Tele-MANAS. This has really brought revolution, thanks to Dr. Pratima and her entire team who has worked on it and got it implemented, and the officials in the Ministry of Health and Family Welfare got it done. A few things which I was thinking that should need to be added. Today we are already launching the Tele-MANAS app and also the video calling facility. But one thing which we need to do is more of IC on this, because during my field visits, I generally found the awareness was not there at the lowest level. So then after returning, I sent a letter also to all the states that you need to bring it down to the village level, because if you go to the Ayushman Arogya Mandir or when you interact with the villagers, all of them today are aware of 102, 104, 108. Similarly, 14416 should be in the mind of each and every person. Same thing we should do for schools and colleges, that all students are able to access. Today we have a very limited number of students calling in this number. I was just going through the figures. Out of 14.5 lakhs, most of the calls come from between 40 to 50 age group, the 35 to 45, 50 age group people. So that is basically people being troubled with their family life or with their office work. The adolescent group, they are around 10 to 15% of adolescent group are in our ambit, but we need to increase it, because if you just do an analysis, a person at the age of, no one should die young, or no one should die before the age which is defined for the person. We always say कि जन्म और मृत्यु ईश्वर के हाथ में होता है. No one knows when we will die or when we will come into this world. But when we are there in this world, we need to ensure that we lead a happy, contented life. Even if there's less of money, less of requirements, or less of worldly pleasures, as you may say, yet one can remain happy and contented. So for that, the adolescent age group, I was just thinking, and yesterday I was discussing with my team in the ministry, the adolescents are nowadays becoming very anxious and very impatient. Students not getting full marks, wanting to commit suicide. Shocking. We, in our generation, people used to fail, still they would be happy. Because ठीक है, हो गया, माँ बाप से 2-4 डंडा पड़ गया, टीचर ने 2 थप्पड़ लगा दिया, ठीक है, हो गया, बट दोस्त मिल गए तो दोस्तों के साथ फिर हंस खेल लिए, भूल गए, अगली बार देखा जाएगा. And parents would also say that, ठीक है, अब अगली बार मेहनत करो, टीचर would say मेहनत करो, तुम पढ़ते नहीं हो, पढ़ाई करो तो तुम पास होगे. So that was the resilience that our generation had. Nowadays, I don't know, maybe because we have not brought up our children in that environment, maybe we have given them such a cozy environment. Now children are so, temperamental, so they feel that if this is not achieved, then world is gone. That I think we need to address, because it's almost there in every family. I know my son is quite resilient, and usko bhi वैसे ही वो बनाया हुआ है. So he has his friends and he keeps telling me stories. कि मेरे ये मैं वो बोला था कि नहीं मैं जाके सुसाइड, मेरा इस बार नहीं हुआ, इसमें मेरा इंजीनियरिंग में नहीं हुआ तो मैं कूद जाऊंगा. School incidents happening in front of the other children. So this is the age which we really need to target, because we are losing the future generation. माँ बाप पर तो क्या होगा वो जानते ही हैं, but it is an impact, direct impact on the society. So these adolescents really need to be handled with care, and I think Tele-MANAS can do that. One more idea I had, actually, when I just joined as ASMD, I think after a month only, we had this AFMC Pune call center, special cell being established, which is for the Central Armed Forces. So at that time, I was just thinking, should we think of a dedicated cell for students, for adolescents, not students. There would be dropouts also for adolescents. They have lots of issues. Peer pressure, parents' pressure, the teachers' pressure, education, their own physical as well as psychological changes happening in the body. मेरी दाढ़ी नहीं निकल रही है, that is a tension of boys. So these are small things, but at times people take it to such an extreme level that the person goes under depression and anxiety and feels like committing suicide. मेरी तो जिंदगी में कुछ रह नहीं गया है. Such, I feel this is a big group, and I think it's almost in the entire society, be it rural or urban. More so in urban, mostly I have found. But also now it is going to rural also, because the aspirations of rural youth also has increased. They have access to mobile, so they also know a lot of things are possible, and if not, if they do not get it, so they also feel rejected. So this is one sector which is very close to my heart, because I have helped a few students come out of it also, my son's friends and all that, and some of my friends also, in their workplace, in their, and some members in my family also. I have seen them go through this due to maybe, problems in the family or in the office or with the children. So this I think we should focus on, and I'm sure to be delving on various problems. Those who are causing this anxiety and depression in other people's lives, they also need to be counseled, because I feel they are also not normal. They also need counseling. So both things I think we should be targeting. And I'm sure today's workshop will be very successful. And from today, for 1 week, we have also sent letters to all the states to organize, awareness camps at the Ayushman Arogya Mandir, have various activities with school children, engage them, awareness on the Tele-MANAS app, how to use it, and how to improve it, and lots of reports and assessment reports on all these to be launched today. All the very best. Thank you.
Thank you so much, ma'am, and thank you to everyone. As we all know, today is the 2-year anniversary of Tele-MANAS. I invite you all to witness the journey of its journey in the last 2 years.
हर तरफ हर जगह बेशुमार आदमी, फिर भी तन्हा आदमी। हम सब कभी ना कभी जीवन के किसी ना किसी मोड़ पर इस एहसास से गुजरे हैं। आज लोग समझ चुके हैं कि मानसिक स्वास्थ्य कितना महत्वपूर्ण है और इसके सही इलाज और परामर्श से जुड़ी सेवाओं का मिलना कितना जरूरी है। इसी उद्देश्य से भारत सरकार ने स्वास्थ्य एवं परिवार कल्याण मंत्रालय के सहयोग से आज से ठीक 2 साल पहले नेशनल टेली मेंटल हेल्थ प्रोग्राम टेली-मानस की शुरुआत की। इस डिजिटल प्लेटफॉर्म की मदद से देश भर में काउंसलिंग, मनोविज्ञान परामर्श सहित अनगिनत सेवाएं उपलब्ध करवाकर राज्यों में मानसिक स्वास्थ्य सेवाओं को और मजबूती दी जा रही है। मानसिक स्वास्थ्य से जुड़ी किसी भी जानकारी और परामर्श के लिए लोग टोल फ्री नंबर 14416 पर कॉल कर सकते हैं। टेली-मानस लोगों की व्यक्तिगत जानकारी की गोपनीयता सुनिश्चित करता है और लोगों की सुविधा के लिए ये 20 भाषाओं में भी उपलब्ध है। टेली-मानस के इस सफर को आगे बढ़ाते हुए पिछले साल वर्ल्ड मेंटल हेल्थ डे पर भारत के माननीय स्वास्थ्य और परिवार कल्याण मंत्री द्वारा इसका लोगो लॉन्च किया गया। आज टेली-मानस सेवाएं देश के सभी राज्यों में 53 टेली-मानस सेल्स के माध्यम से उपलब्ध हैं। पूरे भारत में 14.6 लाख से अधिक कॉलों को सफलतापूर्वक संभाला गया है। इन सेवाओं को आगे बढ़ाते हुए रक्षा मंत्रालय के सहयोग से AFMC पुणे में सशस्त्र बलों और उनके आश्रितों के लिए एक समर्पित सेल स्थापित किया गया है। टेली-मानस की दूसरी वर्षगांठ के अवसर पर आज 2 नई पहल की जा रही हैं। वीडियो परामर्श अब टेली-मानस पर उपलब्ध होगा, जो पहले से मौजूद ऑडियो कॉलिंग सुविधा का एक और अपग्रेड है, जिसके द्वारा कॉल करने वाला व्यक्ति अब मानसिक स्वास्थ्य पेशेवर के साथ वीडियो परामर्श भी ले सकेगा। इसके अलावा एक व्यापक मोबाइल प्लेटफॉर्म टेली-मानस ऐप, जिसे आम जनता के लिए विकसित किया गया है। इस ऐप में आत्म देखभाल, संकट संकेतों को पहचानने और तनाव, चिंता और भावनात्मक संघर्ष के शुरुआती संकेतों को प्रबंधित करने के सुझाव शामिल रहेंगे। ये मोबाइल ऐप उपयोगकर्ता को तत्काल परामर्श के लिए 24/7 भारत भर में प्रशिक्षित मानसिक स्वास्थ्य पेशेवरों के माध्यम से मुफ्त और गोपनीय मानसिक स्वास्थ्य सहायता से जुड़ने में भी मदद करेगा। कहाँ खो गए हम, हर दिल में ये कैसा गुबार, कहने को सब कुछ है, फिर भी नहीं है कोई दिल हल्का करने के लिए एक यार। कहाँ जाएं, किससे कहें, टेली-मानस है ना आपका दोस्त हर पल।
So, as you have heard, the Tele-MANAS app is a comprehensive medical mobile platform designed to enhance mental health services for the public. I request Ms. Aradhana Patnaik to formally launch the app on this Mental Health Day by pressing the button. Thank you, ma'am. invite you to watch a short video about video consultations in Tele-MANAS. Video consultations in Tele-MANAS will enhance existing audio-to-call service, allowing mental health professionals to gather more information and conduct brief examinations, including a mental health examination. Yes. This facility will be launched in Karnataka, Jammu and Kashmir, and Tamil Nadu, and scaled up across the country. I request Ms. Radhana Patnaik to launch the app, to launch the facility by pressing the button.
A caller reaches out to Tele-MANAS services, and the call is answered by a Tele-MANAS counselor who provides the first line of counseling. Once the call is transferred, the MHP then evaluates the caller and decides the need to speak with the caller over a video consultation. The MHP clicks on Initiate Video Call and takes the consent from the caller to send an SMS link for the upcoming video call. Once the caller and the MHP both join the video call, the MHP verifies and validates the identity of the caller and proceeds for evaluation. After taking history and examining the caller over video, the MHP can now mention a provisional impression and their recommendations in plan of management for the caller on the MHP screen. In case the MHP is a psychiatrist and a medical doctor, they can further fill the section of pharmacological intervention and prescribe the required medication to the caller if necessary. The link of the prescription can then be sent to the caller at the end of the video call. Through this new video calling feature, Tele-MANAS aims to provide end-to-end care to the caller with a platform that is able to have a stepped approach ranging from counseling to prescriptions tailored to the individual needs of every caller.
I now request the dignitaries to release the WHO Tele-MANAS assessment report. The WHO conducted a rapid assessment of Tele-MANAS, coordinated with the Ministry of Health and Family Welfare, to evaluate its performance. The report highlights significant milestones in mental health support and commends the initiative's robust technological framework. I finally request the dignitaries to release the report, the booklet, Taking Care of Your Mental Health Because It Matters. The booklet emphasizes individual efforts to maintain mental health and well-being. Addressing common misconceptions on mental health only concerns those facing challenges.
Can I request the Tele-MANAS team NIMHANS, IIITB, NHSRC to please come up on the dais?
Thank you, everyone. We will start with our first panel discussion of the day soon, so please remain seated. We will proceed shortly. If you would like to have a cup of tea or coffee, please feel free. We will call you back in a little bit.
final steps, you need to you have to record.
Oh, I have to record.
Yeah, yeah, I have
Can
to.
I? But my question is that people are going to sit here, na? तो मैं recorder table पर ही रख दूँ?
I mean, you can just keep. हाँ रख दो ऐसे. I don't think there is a problem in that. आप यहाँ पे भी रख सकते हो.
As it will catch the voices from.
It will catch from anywhere.
Okay,
That's
great,
fine.
great. So मैं यहाँ रख दूँगी.
हाँ, it's good.
ठीक है. बस record ही press करना है ना? On और record.
Right, yeah.
ठीक है. May I request everyone to start taking their seats, please? We will begin in 2 minutes. I request you to please start taking your seats. We will begin very soon. please start taking your seats. Thank you. Good morning, everyone. Please take your seats. I hope you enjoyed your little refreshment break. It is my pleasure to introduce our first panel of the day, Policies and Frameworks to Foster Mental Health Resilience in Workplaces. In this session, we will explore how integrating mental well-being support into organizational policies can enhance employee resilience. Our distinguished panelists will share best practices for supporting diverse employee groups, including those of different genders, abilities, and neurodiverse backgrounds. We'll also delve into the role of digital tools in self-care programs and the critical impact of leadership in building a mental health-friendly culture. Please join me in welcoming our chair for this session, Professor Dr. Atul Goyal, Director General of Health Services. Here you go, sir. Thank you. I now invite our distinguished panelists to the stage. Excuse me. Mr. Siddharth Bhattacharya, Secretary General, Nat Health. Mr. Siddharth Bhattacharya is a seasoned leader with over 25 years of experience in health, technology, and services across India and the US. He has held key roles at Dell, Philips, JVK, EMRI, and the Government of India, specializing in healthcare transformation and technological innovation. He is currently serving as Secretary General of Nat Health, where he leads public-private healthcare partnerships. Dr. M.S. Gautam, Associate Professor of Epidemiology and Public Health, NIMHANS. Dr. Gautam is an additional professor at the Department of Epidemiology at NIMHANS, Bengaluru, where he also serves as the head of the WHO Collaborating Center for Injury Prevention and Safety Promotion. He has developed several public health tools, such as the tool to assess and classify work-related stress, the NCD meter for workplaces, and the school safety assessment tool, among many others. Dr. Sameer Parekh, Director, Department of Biotechnology and Behavioral Sciences, Fortis. Dr. Sameer Parekh is an eminent psychiatrist and has played a significant role in enhancing the image and reach of mental health across the country. He is the Director of the Department of Mental Health and Behavioral Sciences, Fortis, and the Chairperson of National Mental Health Program, which is one of the few multi-city, multi-centric, mental health programs. Ms. Anupriya, Manager, Capital Mobilization, AVPN. Anupriya is a development sector professional and leads ecosystem building initiatives to facilitate capital flow through social enterprises and drive philanthropy and impact investment for the Sustainable Development Goals. She has co-founded SisterCare, a women's health platform focused on addressing polycystic ovarian syndrome and related issues. She is a social impact enthusiast who believes in empowerment through entrepreneurship. Right, sir, over to you.
Thank you so much for doing half of my job for introducing the panelists, which I requested you to. I have to listen today to what the panelists have to say, but may I begin the discussion with stating something which has happened in the past couple of months for that matter. There was this incident at RG Car Institute at Kolkata. We talk of mental health at workplaces. There are a lot of medical professionals here. Have we failed the system by looking at the mental health of the people who run our hospitals. Have we failed ourselves in the first place? That needs to be thought of. If you go around the country and look at the working conditions of the residents, nothing has changed. It is pathetic. So we talk of occupational health, we talk of mental health, but we don't look at our own backyard. So yes, panel discussions are important, conferences are important, even committees are important. Honorable Supreme Court has prepared a national task force which is meeting frequently. I'm also part of one of the committees along with Dr. Pratima, and we've had 4 meetings. We'll bring out a report as well. Will that change things on the ground? That's the important question. What we discuss here, will it lead to any change in the ground? We have a person from the industry, in fact, 2 of them. One of them is talking of, capital mobilization as far as resilience at workplaces is concerned. When will the government start thinking of motivating its own workforce? Will we let them work in the conditions they are? And since this is a program of the government, I think this thought has to come to the policymakers, whether we are looking at the mental health of our own people working in our own sector for the government of India. So with this, I will first pass on this mic to Mr. Siddharth Bhattacharya, who is sitting next to me, where again the question is, what role does industry bodies and associations play in advocating for better mental health policies, and how can the government initiatives and corporate policies align to create a more robust framework for mental health at work? Again, you are from the corporate sector, but I would like you to talk about certain initiatives that the government needs to take place, needs to develop for looking at the mental health of its own workforce. So we are not looking at only the industry, the government workforce as well.
So thank you, sir. Thank you, sir, for that, setting that context. The topic of discussion is very, very close to my heart, as well as probably one of the most, silent epidemics that we will be facing in the coming years. We already have started seeing what some incidents which you referred a couple of months back. About 150 million, probably the environment has 150 million mental health. People who would require mental health assistance. Nearly 75, 3 out of 4 are undiagnosed or untreated. And we have a scale problem, we have a reach problem, and I think some of the announcements made earlier today are steps in the right direction. A lot more we'll have to do, and together with government and private sector. In my response, sir, to your question, I'm going to take on the federation hat and be mindful about the role industry federations can play working with government. I would like to take us back about 2 to 3 years back. And we are at the heart of COVID. And, what we faced, if entire India was under a storm, the health sector was in the eye of that storm. Because ultimately the question, what you said, the healthcare providers, the doctors, nurses, the paramedic workers, the allied health workers, they all came under severe strain. One, that the disease itself was unpredictable. Second, what impact it has for their family. They were forced to work shifts because of the nature of the virus, often 7 days in one go, alternatively between, they hardly had time to spend with family. A whole lot of questions came up, and then the same question came up. If you are not safe and your mental health is not in the best condition, how are you going to extend the support and the well-being to the rest of the population who are looking at you? As a federation, we had gotten many of our private sector companies together. We had numerous rounds of conversation also with government. And the 3 things that emerged for us were, and I'm just going to keep it very simple, not get into technicalities. As federations, I think we felt the feedback was that we needed to play an active role in collating publishing, disseminating the different avenues and support resources that are available for any employee, whether it's a doctor, it's a nurse. There's a lot of support systems available around. A lot of times it is Googled, but what is credible and what is not credible, remains to be seen. And often what we did were numerous expert sessions. We put out a lot of conversations around, cases of, mental health. It's just to make sure that everybody felt it was not unique to them. And what were in organizations or at an industry level or at a broader than industry level, what are the go-to, resources that are credible? We felt that that was very, very important. We documented, we created in our websites the easy to kind of access link, had mechanisms how people can reach, man desks, and that was something that actually gave us good results in the second phase of the pandemic, particularly when the chips were down and the third phase was not predictable. The second broad area, what as a federation we got into was, there are a lot of good practices. We brought a lot of the industries, they were working within the organizational boundaries to the best way they can deal with morale. But there were individual brilliant practices, which we played a role in terms of disseminating. And not only disseminating, but bringing top CEOs together and things that have worked in one organization. I can give you some examples, brilliant examples where, an organization could take a part of they actually volunteered to give a part of their paid employee time into a common pool available to the frontline workers to kind of take some time off once the pandemic was over. So this felt a collective sort of a well-being. Everybody became a part of a common mission. And it was understood that mental anxiety, mental stress is something that is natural in that sort of an environment. The second thing, of course, was using CSR or using grant or philanthropic funding. There was an ability to also operationalize or scale up some of these good practices centrally, as opposed to taking it from an organizational boundary into a larger sort of boundary. So in terms of good practices, whether it's through awards, through rewards and recognitions, visible ways of making a dent. I think the third part, and there I would say government played a very, very supporting role. One of the key reasons for stress during that period was, what happens if something happens to me? What happens to my family, right? So I think it's very important to look at, as you look at employee benefits, to look at riders in the insurance policies for mental health. And work cohesively with payers, make it a priority for the benefit packages. In fact, for cutting-edge therapies, treatments, government can also be an early adopter, allowing critical investments to be made for benefit of all citizens, whether it is insured, PPP, or in out-of-pocket expenditures. I think government actually opened up for the notified centers. Any health worker would be covered automatically under life insurance and health insurance. So those were some of the top three things. I absolutely agree that unless charity begins at home, and unless we are able to fortify the care providers and work cohesively in some of these areas, we'll not be able to do justice to the broader population. Thank you.
So we'll come back to you again through the course of the discussion. Now we go to Dr. Gautam, Assistant Professor Epidemiology and Public Health at NIMHANS. And can you actually reflect on some evidence-based interventions of organizational level for addressing employee mental health and well-being? And probably you could mention about certain things that you've done at NIMHANS for the same, which could be replicated at other institutions as well.
Thank you, sir. So before I actually go on to say what works at the organization level, I would like to drive a very important point that the workplace organization, health systems organization and services in workplace is largely a compliance related matter. It's a service for an health and family welfare department, but for a workplace, it's a compliance related matter. And this impinges on every attempts to set up workplace health systems for mental disorders, mental health, non-communicable diseases. And that's one thing that I've realized since the past 10 years. And also the scale of the problem here. We have to understand that it's a societal role that we play as an employee. For 8 hours, we are employees, we are a part of the workplace system, and the remaining time, we are who? We are just a subset of the population. So there are risks for mental disorders in the larger population and risks for mental disorders that are specific to the workplace settings. And we should try to address these risks that are specific to the workplace settings. And that will give some amount of buy-in for people who are trying to establish systems in workplaces. And when we started working on that, we realized that there are 3 types of policies that basically need to be tackled. One, the policies by the Health and Family Welfare Department, do they mention about anything related to workplace mental health? The policies by the Labor Department, do they mention anything at all with respect to the mental health systems in the workplaces? And second, most of the companies have their own global policies, local policies. And sometimes the global policies are actually at a very much higher level that is set for countries, even which are high income countries. So these 3 policies, and we have to find a common ground between these 3 policies. And when we did an analysis of 40 legislations from the occupational health sector, and the mental health policy, the mental health program, the multi-sectoral action plan of the non-communicable diseases, as well as the OSHAs, the basic occupational health services, we understood that there is very, very little scope or there is a very little mandate for mental health. In fact, the biggest mandate for mental health is from the state directive principles of state policy from the Constitution of India, Article 42, 43 and 43A that says that we must provide safe and humane working conditions for employees. And one common ground that we found was trying to enter an organization through the window of managing work stress. And from there, trying to build issues of screening for mental health. Screening, in fact, they don't like the word mental health. They are okay by calling emotional, they are okay calling psychological wellness. So, but there's still a lot of taboo around mental health in this. So what we did at NIMANS was, we developed a work stress assessment tool and screening tools and piloted in some industries. Way back in the year 2017, 2019 we started, and it was well received. We had to face a lot of resistance and we improvised it over the time. And work stress is very essential. It's essential for progress. It's essential for evolution of the domain as well as the character of individuals. But what we told them that it's the harmful levels of work stress that basically affects your cortisol levels, your adrenaline levels, and that can lead to problems both in individual as well as the organization. At the end of the day, it's an issue of you seeing an employee as a partner in productivity. So we developed the tool to assess and classify work-related stress, and currently it's being used by more than 30 to 40 industries. People have adapted in their particular settings, and it's available in 5 to 6 languages. And at the end of the assessment, it basically gives whether a person or employee is having a work stress or not, what is the level of work stress, and it also gives a indicative guide to the organization as it divides the employees into red, green and yellow and says what proportion of employees are required for a particular type of intervention. This is one thing that we have done, sir. And secondly, we have developed screening tools for use because the window of time that's available for a periodical medical examination or opportunity screening is very small. When we started in Toyota, it takes 3 minutes to assemble a car. And when I asked 15 minutes for screening of employees for mental health, I was just shown the door. So how we manage to overcome these issues is something that we do. And the policy strengthening with support from WHO and the then economic advisor, Nilambut Sharan, the Joint Secretary of Health, we basically developed a policy brief for strengthening non-communicable diseases, quote unquote, including mental disorders in workplaces. It was released. And then we also developed a report for strengthening existing policies and legislations. We reviewed all the legislations, and when the Occupational Safety and Working Conditions Code was launched by the Department of Labor in 2019, we strongly advocated for including components of non-communicable diseases and mental disorders in the OSH code, but unfortunately it was not included. Our report clearly told which part of, like for example, the OSH code has got chapter 3, 4, 5 and 7, each with looking at the duties of the employer, OSH standards, responsibility of employer, and records. What needs to be included in each of those things were clearly written there. So it requires, the main beauty of this occupational health is that if we tweak the legislation, systems fall in line. And the size of the population is 30 to 40 million in organized workforce. 537 to 550 million people classified themselves as workers, out of which 8% are in the organized sector. Manufacturing sector is close to around 20 million, 3 to 4 lakh industries. So with one stroke of a pen, it's possible to bring in systems and services. I'll just conclude by saying a simple example. The IT employees still come under the Shops and Establishments Act. So the Kirana store and Infosys are same in the eyes of the government. So if tomorrow Infosys decides that I am not going to provide anything, they are okay. I mean, they are within the legal ambit of the law. So we should basically try to work at two levels. One, try to change the policy at a higher level. At the same time, try to build evidence at the lower level. And there is a clearly shortage of evidence. As sir asked me to talk about evidence, sir, there's a clear shortage of evidence with respect to effectiveness of programs. We have evidence with respect to what is the prevalence of work stress, whether it basically improves, but we need to link it to productivity. We did a health and productivity study in Toyota for over a period of retrospective cohort study for 10 years, and we found that close to 1.8% of total work time is due to health-related reasons. But to see if any interventions is making an improvement or not, there are a lot of data-related and privacy-related issues that limits a person from generating evidence in Indian context. So I do not have the answer to say that what really works, because we do not have a published evidence. We do not have a published evidence. Thanks.
Thank you, Dr. Gautam. Now coming to Dr. Sameer Parekh. You would make a mention of the various aspects that need to be considered while formulating policies for fostering employee mental health and resilience at workplaces from the perspectives of an employee as well as the society.
So just start, I think, Dr. Goyal, when you mentioned about what's the point of conversations if it doesn't convert into action, and if the action doesn't convert into something, I mean, as simple as that. Ma'am sitting here, Bhavuk sitting here, so there are a lot more from my side of the world, experts who know a lot more are sitting on the other side. But I've been 25 odd years now in private practice. I'll say it how I see it. I just don't feel mental health has been a priority. I think we're beating around the bush if we think that we've made it a priority. I think private sector largely has failed mental health more than anything else, whether it's private sector in the healthcare provider segment, whether it is the private sector in the corporate segment. You can't start a conversation by what we can do until you also accept what we've not done. And that has to be a very clear understanding. You walk into a healthcare provider tertiary care network today, and you will not find an integrated mental health program, right? If you are not going to talk about cardiac surgery or neurosurgery or trauma, and if you don't integrate a mental health component there, then what in the name of health are we doing that? Look at one preventive health program and see how many of them have integrated mental health. That's a fact. The second part is this whole aspect of what the industry can do. The industry needs to start by saying it's not done much, rather than enumerating what it has done, because it's just pointless. We keep talking about the need of impact, even evidence for that matter, sir. I don't see it like that. Human right doesn't require evidence. Mental health is a human right. Now, whether you provide for the mental health and does it help your bottom line or top line or not is all secondary business. First, get your human rights on track. And that has to be the case. Now, whether it is when you said in terms of the mental health professionals or anybody working for that matter at any level. And that intent has to be there. I just feel our intent doesn't last. I mean, we have these conversations which are lovely, right? We just don't last through the 365 days. Although, I mean, to be very honest on this, I was just telling this to Bhavuk. My take on Tele-MANAS is that probably it is the most significant, impactful initiative globally that mental health has seen. And I truly believe that over the next decade or so, the world will realize the sheer impact of Tele-MANAS. So anybody and everybody who's involved in Tele-MANAS, just take a bow, because you do not know the impact of what you are doing. We run a very smallish crisis intervention helpline for under a decade, right? I know what it takes to run it 24/7, where clinicians out of their own time spend time. I am on that helpline several times a month. But to do what we are doing here, the intent, and that's what should inspire us. The government's approach to mental health beats the private approach to mental health hands down, right? And that has to be the case. I mean, if you ask me, then one of the things that I'll never forget is the Honorable Finance Minister's speech on budget when mental health was spoken. I would have never thought in my lifetime I'll hear the word mental health in a budget speech, right? So the government, in my opinion, sitting from the private sector, is walking the talk, and it's walking the talk big time. So Tele-MANAS, absolutely remarkable. I see it changing the landscape of mental health probably in a decade or so globally, because people will learn, this is your efficacy, this is your evidence. And the evidence is about outreach. We keep talking about the fact that we don't have enough people, but we don't realize we also have one of the most robust digital transformations that any country has seen globally again. Digital India is our power. Tele-MANAS has shown that. The fact is how many, over several lakh people have taken advantage, including psychiatry. I mean, what remarkable that is. Now you compare the data of Tele-MANAS to a data of a leading private healthcare organization. I mean, it should shame us. And that's because we keep coming back to what it does to the bottom line and the top line. And that's why I believe mental health needs to be seen as a human right. Until we don't see mental as a human right, and I know, you spend $1, you get $4 in return for mental health, all that is fine. But the fact is, if you don't see it as a human right, the rest is all just whataboutery. We need awareness in a sustained manner. Awareness cannot happen intermittent, and awareness cannot happen if all stakeholders don't take part in it. You just compare in the last 5 to 7 days. 3 major days have just come around. World Heart Day, if I'm not mistaken, I think Breast Cancer Day also, and World Mental Health Day. Our priorities are not sorted. There is evidence and data that if you put cancer plus COPD plus diabetes on one side, and you put depression and anxiety on this other side, the cost is more here. But the investment and attention is all there. How are a handful of mental health professionals, and they are only a handful of them, going to be able to make it work? It's just not possible. And if you do awareness and you don't bring access, awareness is stupid, because you are creating more void. You tell people, see, this is a solvable problem, but I don't have a solution for you because there's a waiting line. It doesn't work like that. Or if there's an affordability issue and so on and so forth. I mean, the government has done well in terms of ensuring that private insurance sector supports mental health. I mean, how can they not? Be it in OPD, IPD, or any which way, insurance sector has to walk the talk. How I see it, whether we talk in terms of differently able, whether we talk in terms of mental health, whether it talks in terms of neurodivergence, to me, it boils down to acceptance. Acceptance that we have failed, acceptance that we need to work faster than what we have, acceptance that some of these things need to be just driven by policy and be made mandatory, right? We have all sorts of certifications, ISO this, NABH this, that. I mean, all sorts of things you will see people talking about. You know, we have accredited with this and that and this and that. Where is the mental health? In absence of, I mean, why can't organizations do something as simple as a psychological first aid training for all employees? Surely that's very doable, and you don't need evidence for that. The odds are that, I mean, you all, I'm sure, would be ACLS, BCLS, CPR, whatever else the training is, and they're all life-saving, absolutely. But you are not going to, every day you will need to give psychological first aid to people. And you'll need to give support to people at a different level, at a much lesser frequency, but we just don't do enough there. It's embarrassing when you even look at the tick in the box that happens in organizations. You do a stress management talk here. So I have a stress management talk in the evening today. We do what we do. It's just embarrassing. I'm embarrassed to even give that talk again because I've been saying the same thing for now 30 years. It's been, and I just say the same thing again and again. In fact, my jokes have also stopped changing. It doesn't make any difference. They'll forget it. So they'll laugh at the same joke every time, even if you say it every 3 months. That's the fact. So for me, I just feel 30 odd years in the field of psychiatry, the fear that one has very less time left and what more is to be seen, and there is so much more to be done. So that kind of bothers me a lot more now than when I was much younger like Bhavuk, and I just saw Sir Dr. Sagar also joining in. Quite embarrassing speaking in front of you, ma'am, and Dr. Sagar. But I'm saying it in a way that it is what it is. I think let's just cut the rubbish of whataboutery. Let's understand mental health needs a lot more. Private sector, industry bodies, private healthcare organizations, corporate sector, organized and unorganized sector. If we just end up doing about 10 to 15% over the government's intent, and the initiative is, I think we'll make an impact, and that's the only way to look at it. Mental health is not about anything else. It's a human right, and if you are not providing for mental health of individuals, then you are failing them on the level of human right. That's the only way to look at mental health.
Thank you, Dr. Samir. I will make some comments on what you said later on when I summarize. I'll go to Mrs. Anupriya. You are going to mention about the challenges and opportunities you see in terms of adopting and implementing high-impact policies for promoting mental health and resilient workplaces. Please go ahead.
Thank you, sir. Before I start, I would like to say that I completely agree with Dr. Gautam when he said we clearly lack evidence. And that is where we kind of also face challenges when we are raising funding from private sectors for funding mental health interventions. And I've seen everyone is expert here, so I'll try to bring in some employee and workplace perspective to the conversation. There's no doubt that there's about the correlation between the productivity and mental health. Though we do not have specific kind of matrices or statistics which talk about that how mental health impacts at organizational level, but we do have some overall statistics which talk about how mental health impacts the economy. So the World Health Organization, it estimates that between 2012 to 2030, India would have like estimated loss of $1 trillion USD because of mental health conditions. So now coming to the policy framework, so I'll reflect on the policies with the question that have been asked, that we do have some key policies and frameworks that provide foundation for promoting mental health at workplace. We do have mental health, national mental health policy, which outlines the broad vision for mental health, and also advocates for integration of mental health into General Healthcare Act workplace. Then we do have some Mental Health Act 2017, which provides mental health rights and also emphasizes the importance of providing supportive environment for employees in the workplace. Then we have Factories Act, which is about large workplaces, especially the factories, and mandates to include mental health services under expanded interpretation for employee welfare. Then we do have CSR, wherein we have ambit of funding mental health interventions. But beyond that, when we talk about mental health in the organizations, we see that mental health policies in organizations are very fragmented, though we have growing policy framework. But where we come, when we talk about the challenges, it's mostly about the implementation. We do have, in large corporates, we do have some kind of programs, but which are more to the perspective of compliance. But when we say that integration of these policies or these kind of programs at the broad organization strategy level, we do not see that. Very basic, for example, in organizations, when I report to my managers or other people, if they do not understand the concept of mental health, so how do I can ensure or maybe talk about these issues at workplace? Very small, loosely related anecdote. My dad, who served in public bank for last 30 years, amazing dad, and like all the girls would say, very diplomatically cool. But when I go to him, tell him it's about anxiety, thoda anxiety ho rahi hai, he'll be like, steel ka dimag banao, ye sab kuch nahi hota hai. And I'm like, okay, thank God you're not my manager, right? So it is mostly also about systems around mental health and how organizations adopt in their business systems. For us, when I cannot go to my managers or my leaders, I cannot talk about it. And I'm spending there 8 to 10 hours. So how do I deal with it? And also, through the career, we as managers also are never trained in our leadership skills or anything, that how do we act with people around us, or how do we become the first responders and provide that support. Also, throughout my education or the employment, I would say that I've never learned that when do I seek help? So there have been small kind of stresses and all of that. But where do I learn that, okay, this is the point where I need help? Or how do I be the first responder? And each day, for example, last year someone came to me and they were like, I'm feeling differently. And I mean, they shared the issue with me. They're professionally close. And then I was like, okay, what do I do now? Because through rolling on the Instagram, I read somewhere that you do not say that, don't worry, everything will be okay. That is the worst statement to say to someone. But what do I say to them? I cannot reach out to their family because I don't know how would they react. And that's the cause of my problem now, that what if something happens to them? So we are not prepared at any level also. So with the 3 components that I see, right, 3 A's that I talk about, wherein awareness, accessibility, and accountability, we lack awareness. We do not know when to seek help. We do not know where to seek help. In rural areas where I can come from, I do not hear people talking about it. Even if you say that, okay, I have some issue, they'll be like, "Dimag kharab ho gaya again." And when you say, actually mein ho gaya, they wouldn't understand, right? So similarly, then accessibility. With Tele-MANAS, accessibility is increasing. But again, it then accountability for it from my managers, from the people that I'm around. Nowadays, because of we're losing those social connects around our families. We spend most of the time in our company, in our offices, and then later thinking about the offices, working about the work. So that's the closest frame of people that we have, and that's where we need support, but we are not prepared to provide that support. So that's where I see a lot of gaps, and yeah, so we would need systems at the organizational level that could cater to it. And maybe organizations see it not as something which is they have to be compliant about and just provide, okay, which I see in large corporates that we do have access to telehealth, but beyond that, there's a lot of support that you need from leadership to actually access it is not there. So yeah, I'll rest my case here. So.
We are left with about 15 minutes. I don't think there is a time for a second round of questions, although I am inclined to ask one question to Dr. Gautam. Dr. Gautam, do you think there is a difference between the mental health issues in the corporate sector and in the government sector? If yes, because you've dealt with both, you said you conducted a study in Toyota and you work in a government institution, although that government institution happens to be an INI, which is quite different, because when I look at the real government institutions, they are the state medical colleges. So do you find any difference between the mental stresses, mental health issues at either of the places?
Yeah. Thank you, sir. I think that's a very important question. So I would be very specific in the answer now. Now, what we realized over a series of studies, both across manufacturing sector, IT sectors, and even some academic sectors and service sectors, the prevalence rates that we have basically observed is a reflection of general population prevalence rates. It's more or less the same, depression around 4 to 7%. Work stress is one thing that we have dealt in more harmful levels of work stress across different populations. The government workers having a higher levels of work stress, somewhere around 15 to 16%. Most of the IT employees where we studied as generally believed that they are highly stressed. I never got more than 12% in any of the IT companies that we used our TOS. We have studied some nurses working in a multicentric study of nurses in the state of Karnataka who are working in pediatric ICUs. We got more than 33%. A postgraduate study on health administrators in hospitals in Bangalore. They could be hospital administrators, nursing matrons, basically doing an administrative work in a hospital, both from private and government sectors. The stress levels was increasingly high, more than 35 to 40%. And the prevalence of the screening, many a times we do not have the liberty to undergo a diagnostic assessments because of the time limitation, as I told earlier. So the screening tools revealed a higher prevalence of anxiety or common mental disorders, depression, anxiety. Substance use often is underreported, but it is, everyone knows that it's very high. Alcohol use and tobacco use, especially in the corporate sector and manufacturing sector, it's very high. So from the limited evidence that I have, I believe that whatever we are observing in the workplace mimics the general population prevalence, because at the end of the day it's a subset. A little increased risk because of work-related factors. If you take which are the key, there could be n number of work-related factors, but the key factors are: one, the organizational work style, that is working hours, job demand, and the role ambiguity, which is very important, role conflicts, career progression, which in government setup is little more what you call kind of structured, but does not happen in time, under promotion, over promotion. Work-life balance in government sector, I believe, is going to be more hampered as compared to the private sector, in contrary to what many people believe, especially who are in administrative roles. And lastly, the organization support in terms of building the skills of the employees to actually perform the tasks. All these directly impact the coping levels of the employees. So there is evidence that basically gives in number of figures as what proportion of people have mental disorders. But what is being done to address that in government versus private? So what, from my experience, what is being done in private, you can correct me, doctor, if I'm wrong, they just do one of these 5 things. Most common is having stress management programs, stress busters. They help you actually forget the work stressors for that moment. But the reason for work stress is work stressors. And work stressors affect the individual and organization both. Second thing what commonly they do is, they develop peer support counselors by training identified or interested volunteers within the workplace, so that they can identify people who are at risk or who are having some mental health symptoms and then bring them to the occupational health center. But seldom it happens that employees don't like to actually go and confide within the people in their own organization, because it could have work-related implications and other things. And some of them have set up helplines. And lastly, the referral. The easiest thing to do is, since they're all covered by insurance, they tie up with a private hospital network for psychiatrists. But if you look at the support from the government side, many of these things are lacking in many places. So I do have strong reasons to believe, though I do not have figures, that in specific government settings, I believe the prevalence of work stress could be much higher, because there is a lot of job demand in the government sector. Instead of fixed working hours in many of the so-called private sectors, there are people in private sectors who are stretched too much in order to achieve the targets. But it depends. We can't just have a watertight compartment to say that it's more in government versus private or it's more in private versus government. It is more related to the role of the person irrespective of whether he is in the government or the private.
Thank you, Gautam. So I would now make it open for questions from the House first for about 10 minutes. Any questions to any of the panelists related to what they've spoken? Any question, please raise your hand, introduce yourself, and then also mention the fact that whom are you addressing the question to.
Good morning, everyone. I'm Dr. Ankur Sachdeva, Professor Psychiatry at ESI Medical College, Faridabad. I'm representing Ministry of Labour and Employment today. So my question is to Dr. Gautam here. So you've spoken very well about the issues and the policies that are pertinent in the organized sectors. My more than question, it's my query to you. For example, you've assessed the workplace stress at different factories or different organizations. So I'm sure you must have done it cross-sectionally. But once you come back, how often do you think the companies engage with the same process and they follow up with that? Because I don't see it happening. We have been associated with multiple factories in Faridabad, and we do these scams and mobile clinics, but I don't see them making difference because I don't see any initiative from the companies or the organizations to follow it up. So what is your take on that?
Yeah, so that's exactly what I'm trying to say. Unless all the workplaces, especially the manufacturing sector, they work on a compliance mode. The occupational health system is the outgoing part of the company where money is going away. They don't believe it's a partner in productivity. Unless since it is not a mandate in the Factories Act or currently the OSH code, the sustenance is not there in many workplaces that we see. But many workplaces that I've seen, my experience is limited, but they do take it in a sustainable mode because they have some global policies to fulfill. They have some certification standards, OSHAS is there. So in order to fulfill all that, they do sustain. One example is, see the Reliance is having a Relafit and they have this Relascore, lamp lighting program by Siemens. And then there is, now recently HPCL has started a Manodarpan program. But most of these programs, they just do one of these ABCD, what I told. They just screen, they just connect, they just inbuild capacities. Unless it is made a mandate, unless it's part of the reporting system, unless it's part of the notification system, then it will be linked to sustainability. Because unlike the mental health in the population where there are resource constraints, we have to understand that there is no resource constraints in the formal workplace. There is no resource constraints. So unless it is made a mandate, in fact it is easier to implement these systems in the formal healthcare system. So sustainability is there whenever it's a part of the global program. Sustainability is there whenever the person sitting in the top feels that this needs to be implemented. Sustainability is there when the company has experienced some adverse event in the form of suicides or in the form of the union pushing for such a program to be implemented. Even in such cases, it is limited to 1, 2, 3 activities.
I'm Dr. Puneet Yadav. I'm from IHMR, Delhi. My question to Mr. Siddharth Bhattacharya. This is actually just a point noted from what the panelists have already got out. Has our human resource practices and the training that we impart in our management institutes and others actually not kept pace with the socio-economic growth and the population growth especially? And so has it actually impacted our training, our capacities for HR kind of a delivery in the corporate world, and as well as government? I would put it on both sides, which is actually reflecting on the mental health issues.
So thank you for that question. I think in the earlier session, the additional secretary was making a great point, right? That, I mean, this is a generation of smartphones, social media, and the kind of stress, that you observe in the workplaces and otherwise, probably the nature of it, the contours of it are changing. So, I mean, from a management education perspective, yes, it's important for it to keep pace with the changing times. My strong sense is there's a need for executive education. Education is important. Re-education is equally important, or continuous education is very, very important. I know the likes of, Indian School of Business, IHMR, others, have a whole lot of, emphasis on top executive education. And in terms of the way, with the changing times and the changing needs, flexibility, different contours of, areas of work life which extends beyond the 9 to 5, often into 24/7. How do you cope with that environment? This may be a great subject, and maybe through a federated sort of an architecture with other federations, that could be a good way for us to disseminate, collate the inputs, and then work with academia to distribute.
Good afternoon, sir. My name is Dr. Balu Mote. I am from NHSRC. My question is again to the Gautam, sir. So you mentioned that there is a interventions in a workplaces, but we don't have evidence of their efficacy and output. So are we talking about here only like quantitative part of like analysis or that evidences, or are we also talking about individual level best practices qualitatively? If qualitatively evidence are existing, then as a part of policy making, what is hindering to incorporate those qualitative evidence or best practices into the policies?
So thank you for your question, sir. So I was referring to both. So basically, I was referring to evidence that's basically published that says that you do a mental health program. This was the baseline. It has improved so much from point A to point B, and this is the return on investment for every $1 spent on the program. This is the benefit to the individual in terms of presentism, how much it has changed, because presentism is the main issue for an employee who is affected with mental illness. And the organization, how much it has benefited from in terms of improved productivity, decreased absenteeism, decrease in the number of strikes or those kind of issues. This kind of evidence is not present, is what I was talking about. Evidence, data is present. When I talk about evidence, I'm talking about published evidence, because data is present with every industry. They know exactly how many of them work, how many of them don't work, how many of them are absent, how many of them have entered, because they do generate data in the periodical health examination every year. So that is what I was talking about this. And nothing prevents you from doing interventions. I don't think it should be evidence-based, because there's a larger evidence base that says that depression is manageable and stress can be reduced, the stressors can be reduced. So those kind of interventions are already known that interventions work. So interventions, to what extent they work in settings and how benefit it brings, those evidence is not there. So I agree that there's no need to wait for evidence. You can still implement interventions which are proven.
This will be the last question that will be taken from the gentleman on the second table. Yes.
Good morning. I'm Dr. Nilesh Deshpande. I'm from United Nations Population Fund. My question is, I don't know who can answer this, but I just wanted to understand, because we talked of the tool, we talked of affecting performance. So is there any law which can protect an employee from not getting fired on the mental health issue? Because they can remove him based on the performance. Because of his poor mental health, he is going to perform below par, and that can be a very good opportunity for the organizations to sack him or throw him. So is there any which can protect, because that's how the tool can be like boomerang as well. If a company sees these 10 employees in red, they may not want to carry with them. They can find ways to get rid of them. So how do you
You are talking of a law.
Yeah, means like how do you workplace?
May I put a counter question if you can answer that? Traffic laws have been in position for years together. Have they prevented traffic violations?
But there are deterrents.
Today there is a demand for making a law to prevent violence against doctors. Do you think that law will actually prevent that? Making laws is one of the easiest thing.
So I'm just trying
It's
to
the
understand
implementation
for my
of laws.
thing. Like, is there any way?
I will answer that further when I sum up the issue. I think I'll end the questions here, and I think we've already reached the end of time. So I'll just sum up the discussion. It was a lively discussion, but I have certain observations to make. I wished Mr. Siddharth should not have begun with COVID. I am in the process of asking people to forget COVID. So we keep thinking about COVID and going back into the same era of stress. Well, in COVID, I think we created the stress. The healthcare industry and the media together created a stress. So, in other words, the human beings are known to first create problems and then try to solve them. I'll come to that, why I say that. So we create the stress for ourselves and the people, for the generations that follow, and then we are trying to find solutions for it. So, it was mentioned organization and individuals. Yes, organization is a complex, conglomerate of individuals. But are we producing individuals who are probably more susceptible to stress today? Is there something wrong in the upbringing of people today, upbringing of children? Are we overdoing it? Are we overprotective towards them? They have a small stress at school. We run to quarrel with the teachers at school that why is my child being stressed? So are the parents being overprotective? Are we producing a generation of people who are probably not able to handle stress at all? That's a question that needs to be answered despite this panel discussion. And unless you start finding answers to those questions which are more difficult, probably the answer to stress at workplace or the solutions to it will never be found. Well, work stress is being talked. I think some amount of stress is required to excel. You can't have a completely stress-free environment unless you have that basic level of stress. Unless I can notice that my patient is sick, he needs attention, and that stress has to play on my mind. I don't call it stress. It's something which is essential, which is required. So it's how you cope up with that. One individual may be taking it as stress. The other individual may be taking it an opportunity to actually go around and work well. Then Dr. Gautam talked of evidence. Well, Dr. Gautam, evidences are generated. Evidences are generated, and why I say that? You see, you generate evidence, what you conveniently want to work with. And let me tell you, healthcare industry also generates evidence today. It's not the evidence which is neutral and existing. So the evidence that you wish to generate, you always generate. And statistics is a tool that has been used both ways. So probably it's our job to generate that evidence also. You were talking of stress busters in the private sectors. We used to have excellent stress busters in the government sector. I don't know whether you are aware of things like staff socials that used to take place in government medical colleges. They used to happen in JIPMER, they used to happen in Lady Hardinge Medical College. There used to be screening of movies every week for residents, for students. Now somehow we have become so individual based, we are so occupied with our electronic devices, we have stopped functioning as a society. So even if a screening of a movie is done, you will hardly find 5 to 10, 15 people there. Most of the people will be engaged in their own things, in their own electronic media. So probably this also needs to be looked at as a larger picture. Then somebody mentioned about education. Educating people about mental health issues, about stress. Tell me something, is education going to take care of everything? The day general knowledge was introduced as a subject as part of education, general knowledge completely vanished. There are some things which can never be taught as part of education. For example, ethics. For example, communication skills, although we are trying to do it. But will that be done? How can you learn communication without communicating? So if communication is going to happen through social media and WhatsApp, how are people going to learn communication skills? Needs to be thought of. And then why is productivity, you were talking of productivity as an outcome. Why is productivity talked of only as in terms of generation of profit? Why productivity, the happiness index of the employee is not looked at all? Why it's only about the number of patients you see? We never talk of quality, and especially in the government sector. So there are questions that need to be answered, that will remain to be answered despite everything. And for the last thing I would like to say is, please don't make everything a right. Today we are living in a world where everything becomes a right. And the question, the balance between rights and duties is never talked of. If mental health is a right, why it is not the duty of every person who's at the workplace to ensure mental health of the people around him? For the senior, he should ensure the mental health of the junior. You should ensure the mental health of a colleague. And it just requires a little bit of individual effort from every side. Every time you shout at a junior or you shout at a person who works under you, think about the mental stress that you are giving him. So if it's a right, it's a duty. And at the workplace, it's a duty of the employers, every individual for that matter. Don't we keep our own children stress-free? Why do we behave differently at work? The people who are working under me or for me are equally important for me. If I don't keep them stress-free, how do I take work out of them? The quality would suffer, the quantity would suffer. So with that, I will end this discussion. Thank you so much.
Thank you all for this insightful conversation, and I think it's highlighted considerations we can all take back to our own respective workplaces. I now request Dr. Goel to felicitate our distinguished dignitaries with a token of our appreciation. And now may I request Mr. Saurabh Jain to felicitate Dr. Goel with a token of our appreciation. Sorry, we just take a picture, so please remain on the stage for 2 more minutes. Thank you all once again. Please remain seated. We will just clear up. Thank you. Oh, everyone's. Our next panel discussion focuses on a crucial and often overlooked topic, mental well-being in informal workplaces. This session will explore unique mental health challenges faced by gig workers, daily wage laborers, the self-employed, and migrants. We'll also examine how initiatives like Ayushman Arogya Mandirs and Tele-MANAS has provided support to these groups, and look at innovative strategies to raise awareness and promote mental well-being in informal settings. Please join me in welcoming our esteemed chair for this timely and important discussion, Dr. Pratima Murthy, Director, National Institute of Mental Health and Neurosciences. Dr. Murthy brings about 30 years of extensive experience and exceptional accomplishments in mental health. She's a well-recognized leader in addiction psychiatry and has been instrumental in the successful development of the state-of-the-art Center for Addiction Medicine at NIMHANS. She has served as a resource person for various flagship programs on mental health in the country and across the globe. Dr. Murthy has received many prestigious awards and has more than 300 research publications in various international index journals and scientific books to her credit. I now invite our distinguished panelists to the stage. Dr. Rajesh Sagar, Professor of Psychiatry at the All India Institute of Medical Sciences. Dr. Ankur Sachdeva, Associate Professor of Psychiatry at ESI Medical College Hospital, Faridabad. Dr. Bhavuk Garg, Associate Professor of Psychiatry, Lady Hardinge Medical College and a consultant at the National Mental Health Program. And Ms. Swati Jha, Program Director, Jan Sahas. Thank you, and over to you, Dr. Pratima.
Thank you very much. I'm just going to start off with a funny little limerick. I mean, it just struck me when I was listening to the morning session. It goes, man's a funny creature all told. When it's hot, he wants it cold. When it's cold, he wants it hot, always wanting what is not. So I think, we either agree that, from the morning's discussion, is stress a really important thing that we need to recognize? Are we just imagining stress? What's really happening? So I think, but the fact of the matter is that we're all here to kind of see how we can look at workplaces as being, as I mentioned, not just more productive, but happier places to work in. And I think that's really what we need to focus on. And to participate in this panel, we have a lot of people that I know, which is very nice. Dr. Rajesh Sagar. Dr. Sagar is a leading professor of psychiatry at the All India Institute of Medical Sciences. He's an alumnus of NIMHANS, which is very important as well. He's a leading name in the field of psychiatry. And globally, he has more than 1.35 lakh citations. He's the recipient of many awards, international as well as national. And he has served on many national task forces from the Government of India and an expert member on several organizations, including the ICMR. He's also a member of the Central Mental Health Authority. Dr. Sagar, welcome to this panel. We have Dr. Ankur Sachdeva, who's an associate professor of psychiatry in the Employee State Insurance Medical College and Hospital, Faridabad. And he has more than 10 years of experience, and he's completed his MD from PGIMER, Dr. Ram Manohar Lohia Hospital, New Delhi, and his MRC Psych from the Royal College of Psychiatrists, London. He's a fellow of the Indian Psychiatric Society and a member of the National Academy of Medical Sciences, has multiple publications in several national and international journals, has authored many chapters, particularly in the area of consultation liaison psychiatry, neuromodulation, as well as de-addiction. Welcome, Dr. Ankur. We have Dr. Bhavuk Garg, who is an associate professor of psychiatry in Lady Hardinge Medical College. He was in the Department of Psychiatry and Drug De-Addiction and is a consultant for the National Mental Health Program under the DGHS. He's an active member of several national committees at the ministry and has contributed to numerous publications and chapters. Welcome, Dr. Bhavuk. And finally, we have Ms. Swati Jha, who is Director Programs at the Jan Sahas and oversees the implementation of the MRC throughout India. Over the last 20 years, She's been focusing on academic research as well as programs aimed at empowering vulnerable and migrant communities through education. Operating within a rights-based empowerment model, she emphasizes community and systemic linkages, creating diverse opportunities within programs. Welcome aboard, Swati. So let's give the panelists a big hand, first of all. I realize it's a long session between 11 to 2:30, so I think we have to keep energizing one another and getting enthusiastic and passionate about the topics that we're discussing. This panel's topic is really to look at the mental well-being at informal workplaces. And we've talked about the challenges in formal workplaces itself. So when you go beyond, I think these are real problems. When you talk about diagnosable mental disorders like depression, anxiety, serious mental disorders, talk about suicide, we do know that suicide is a growing problem. There is enough data and statistics which support it. And therefore, how do we look at the informal sector? What are the challenges? What are the opportunities? And what are the inclusive solutions? And the idea of what we could get from this panel discussion, so that I kind of convey to the panelists what the scope of your discussion could be, and for the audience for your questions, is really to look at the key factors that influence mental well-being in informal workplaces, as we know them, and how they can be addressed. What are the major challenges when you have to apply mental health interventions? And that could be either improving mental health or addressing mental disorders in people who work as temporary workers, as casual laborers, or self-employed individuals, especially migrants, for example, who are not reached by either the government services or by the corporate sector or private agencies. What might be the role of the Ayushman Arogya Mandirs, which are now present all over the country, as well as something like Tele-MANAS that you heard about this morning, in terms of providing support to to the informal sector? And what are the innovative strategies that you might think of for addressing well-being in informal settings? And maybe even some experiences or success stories of what has actually worked in terms of mental health in informal settings. Dr. Rajesh, let me start off with you. And obviously, like we discussed in the morning, perhaps we didn't talk too much about the factors that play a role in mental health, but particularly for the informal sector, what are the socio-economic factors that might actually play an important role in mental health? And how can these be systematically identified as well as addressed in informal sectors?
Thank you so much. Good afternoon to everyone. First of all, my greetings to everyone on this World Mental Health Day, and also greetings for 2 years completion of National Mental Health Program. Wonderful to be here, and thanks to Ministry of Health and Family Welfare to have this kind of discussion on World Mental Health Day. I think let me start by saying that informal sector is often ignored. Let me tell you this, and in fact, I was reading a bit. In fact, ILO, what they say, all over the world, 2 billion people are in this sector, informal sector. In our own country, up to 80% of people who are working actually are in the informal sector. Like already we have said that daily wage, domestic help, and and those who are working in informal places. So that's a huge number. Now, also let me tell you that they are the one also contribute to the GDP of the country. That is very, very important. And also, in a way, they are also the hugely employed group in that way. Now, I'm glad that we are discussing this particular group, informal sector group. Usually, we don't talk about them. Usually, we do not discuss much about them, because they are the one who are at times living in poor, working condition, and many such when we talk of socio-economic status, and a lot of they are under poverty, and so on, and multiple issues are there. On top of it, there are several health issues again, because mental health and health has to go together. We can't just isolate, health, mental health without health. So But also we need to know, since we talked about the National Tele-Mental Health Program and other services provided by government, now what we have to see that how many of these people are actually using these services. I think we need to take out the data and information that who are, how much there, because it's such a huge number, whether in that proportion they are using the services, their utilization of services are happening to them. And a lot of these, we are in the digital world, we are talking of technology, whether how much the recipient they are with regard to this particular group. Looking at some of the important things when we talk of socio-economic status, they are, as I said, they are in the, many of them are living in a precarious situation, and that is what is reported in the informal, some of the literature which is there for number of reasons, and also we need to know many of them are under debt also, I think, and we all know the debt also plays an important role for a mental health issue, and also it has been talked of suicide also. In fact, we need we be very clear on that, because and they are the one who are the high risk for these issues. Many of them with the low poverty, but at the same time, Professor Murthy will agree, they are also have a problem with alcohol and other issues also, and some of the factors which are there. So in a way, what we need to, because they are important group and often ignored, with multiple problems, mental health issues, but at the same time, when we are looking at the solutions, I think that's what we are discussing. One, we need to see that how they can come into what the services which are being provided by NGOs, government, on how they can be included in that. And we know that in our clinical practice also, like at AIMS, we see many of them actually, they don't come in the initial stages. They come when the situation is very complicated, and that's true for, not for mental health, even for the health issues also. And at least I have seen, and when I get referrals, many of them, they are from different states, they come to AIMS and selling their land also under a lot of debt, they have incurred because of the health issues. So one, we have to see that as a group, we have to, how we can include them, we need to create awareness, educate them, and have a services, what are the barriers, looking at why they are not taking the help which is available to them, what are the certain, because what the barriers are, what the obstacles are, and see that how we can provide, and maybe there can be within that system, when we talk of workplace, maybe that some special accommodation can be there to these group of people. Already I said it's a huge number, because what we talk of corporate sectors and those who are in the formal sector, much attention has been paid, and a lot of, already we heard in the previous discussion many things, but we need to pay a more attention to this particular group. Of course, in our country, ESI is one of the organizations which is providing the health services to them, and there are other NGOs also who are working, and there are certain other issues. But at the same time, we need to see that how we can provide overall health, including mental health, how we can provide a good social security to them, because that also is very lacking, and how we can take care of their needs which are there, and some of the, how we can create a health literacy to them, how we can provide overall even mental health literacy to them, and see that how they can take a proper services which are available. At least we can educate them about the available services, and also at the same time look at some of the where already the utilization of services, look at some of the data, whether the Tele-MANAS or even Ayushman Bharat or even insurance scheme, how much of them are actually recipient of this group of people. But I think we need to pay more attention to this, and maybe have some kind of a guideline, some kind of policy, some kind of more accommodation which can be there, because they are not the one who will come so straightforward to us, and so I think we do not have much information about them. So let us work on that, and we as a group, as a collectively, as a group, even say for example, I am not sure even my institute that how many of them are actually belong to this group who are coming and seeking services from us. And because number of factors, let us work on that as a collectively and make certain guidelines, and that will help us. And as a group, I think we can look at this particular group. And we heard that about there are multiple issues, migration and education for the children, the growing up of the children, and the poverty and poor conditions. So all these issues has to be taken care. And also, I would end by saying, mental health should not be seen in isolation. I think mental health has to be seen in the overall context also. Overall health, living condition, environment, and that also plays a very, very important role. With this, I will end here. Maybe we can have further more discussion after what my panelists would like to say. Thank you.
So you in some ways mentioned that the need to look at the ecological aspects of mental health, that it's not an isolation of physical health or the environment. You also made a very important point that perhaps, especially in informal sectors where access to it might be limited, people might wait until very severe problems come, whether it is suicidality, whether it's substance use, whether it's mental health concerns. So the need somewhere along the line for health literacy to make sure that people at least take help for the kind of problems that they might identify as problems right in the beginning. Let me now turn to Dr. Ankur. Dr. Ankur, you have an experience from the ESI background. So can we look at the current laws? In some ways, we talked about workplace policies in the first session, but here we're talking about labor laws and protections, and how do they impact mental health support particularly for informal workers? And what are the main barriers? Dr. Rajesh referred to some of the barriers perhaps in the community, but in terms of implementing mental health policies for informal workers, what might be the barriers? And particularly for self-employed individuals who have no kind of organization at all, particularly migrant populations, what might be the approaches?
So, good morning, everyone. My warm regards to my fellow panelists, and deep regards to you, ma'am. I'm a huge admirer. So, let me begin by saying that I shall be representing the Ministry of Labor and Employment today. I am surrounded by some stalwarts of psychiatry, so I'll leave the mental health aspects to them. And I shall be talking about the laws and the policies that there are currently in place and which shall be in place shortly with the efforts of Ministry of Labor and Employment. So by starting, ma'am, I'd need your permission to speak a bit about what Ministry of Labor is doing and what the informal workers truly are. So with the permission of the chair, I'd like to mention that informal workers, when we say them as a group, it can be a farmer working in an agricultural land, to a person who's a street vendor, to an auto rickshaw driver, to a construction worker, to Ola Uber drivers, to Swiggy and Zomato delivery guys. Everyone who's not registered with an organization with a contract is a unorganized worker or an informal worker. So let me begin by saying that Ministry of Labor and Employment, especially ESIC, it covers as of now only the organized sector. When I say the organized sector, it means any organization, any factory, any workplace who has more than 10 employees registered with them, and those employees must be earning less than 21,000 rupees per month. Only they can be registered with ESIC. So Ministry of Labor has two main divisions. First is ESIC, second is EPFO. There is one more, but I'll talk about these two because these are relevant to us. So ESIC provides the health benefits, the disability benefits, and all the insurances. The plus point is that there is no cap on the health benefit that an employee can get or any registered employee can get. Even if it reaches in crores, all the expenses would be borne by the ESIC. EPFO works for the social security schemes. So through these two schemes, a worker working in an organized factory or in an organized sector can be very sure that at least I have this basic security that I have some pension, I'll have some pension or some deposit to my name, I'll have some health benefits, I don't have to worry about those health benefits. If I fall sick, I'll have some sickness benefits. If I am disabled, my hand is cut or my limb is amputated, I will be covered. So it gives them this basic security. And even if this kind of security is given to anyone, I'm sure that he would be much relaxed while working, and he would be more confident that there is someone to look after him. But let's come to the unorganized sector. As of now, the Ministry of Labor and Employment does not cover the unorganized sector on the informal sector. However, I am quite proud, little proud to say from the Ministry of Labor perspective, that Government of India in collaboration with Ministry has launched an e-Shram portal where there is provision. It is specifically for informal sectors, ma'am. So, and as of my knowledge, there's no exact data. Millions of people from unorganized sector have registered in that portal. It is freely available on the Ministry of Labor website. Any individual from 16 to 59 years of age who's working informally or in an unorganized sector, who does not pay taxes, to be very clear, can register in that portal. And his account number would be generated in that portal. It is a 12-digit number, which will be linked to his Aadhaar card, Aadhaar number. So through that portal, as of now, only the registry is open. But the main target of this database, it is the first ever database of the informal workers in India. So if that database we have, if the database is completed, how it will help those individuals is, as and when the government plans to include all those informal workers under the ESIC scheme or the EPFO scheme, they will have a ready database to include those individuals. And let me remind you, when we had lockdowns in COVID, these informal sectors was the one most affected amongst all. We still had some savings, everyone had some savings to rely on, we were getting salaries, but these daily wage workers were the ones who were most dependent upon their regular earnings. So in those emergency situations, we'll have a consolidated database of whom to help and where that help might reach. So this is my answer to the first question, ma'am, first part of the question. Second is how the challenges or the barriers that we face in implementing mental health measures to these sectors. As Dr. Sagar said, we cannot isolate mental health from our general health or our physical health. These have to be taken in account. And I would even say to that matter that for these informal workers, who for those sector of people where they have difficulty in earning daily wages also, they have difficulty in eating daily meals, they are least concerned about their mental health. They are totally ignoring their mental health. For them, they even ignore their bruises, their cuts. So I think we should leave aside the mental health. So this is one of the barriers, that they don't give any importance to the mental health. Second is to organize them. Organizing them is very difficult because they are far spread, they are so much in number that there is lack of identification of who falls into informal category or not. ESIC or Ministry of Labor is making an effort, and I think it should hopefully be done soon. Third is implementation. Even if we registered all these people within one framework, and if we make them aware that you have all these provisions, we do not have adequate infrastructure at every place to provide them mental health services. Leave aside mental health services, we cannot even provide basic medical services to all these individuals if we look at far-flung areas. Other factor is migration. These people will continue to keep migrating from one place to another. It would be very difficult to keep a record and managing database as of where they are now at the exact point of time. The last point would be ESI works on a model of contribution, monthly contribution. That contribution is around 100, 200 rupees from every employee, only this. But for unorganized sector, it is very difficult to maintain or track the record of their contribution, because only on the basis of contribution would they be able to get the services that the organized sector is getting. So even if we include the unorganized sector or informal sector, it is very difficult to ensure that they keep paying their contribution regularly. Because there are certain services, certain super specialty services, which are dependent upon the contribution of the employees as well as the employers. So these are the basic challenges, basic problems that these employees have.
Okay, let me just ask you two counter questions, two secondary questions to what you said. Now, the eShram portal that you talked about, what are the bevy of services? What is the bouquet of services that are offered to persons, number one? And the second thing is, Ayushman Bharat itself has a lot of facilities, even for mental health. How can we increase access of the unorganized sector to the schemes under Ayushman Bharat?
Ma'am, there is some slight, some difference between Ayushman Bharat and the Ministry of Labour schemes, ESIC and EPFO. Ayushman Bharat is just a health scheme. We are only providing health benefits, be it mental health or physical health, through Ayushman Bharat, whereas the ESIC and EPFO are social security schemes. We have disability benefits, maternity benefits, sickness benefits. We have sickness leaves, paid sickness leaves. And EPFO, the Employee Provident Fund. So it's a bouquet of services that are being offered when I'm talking about enrolling in eShram portal. Whereas in Ayushman Bharat, only the medical services are being provided. So that is the main difference. When talking about the eShram portal, as of now, only the registrations are taking place. And as to the best of my knowledge, millions of people have already registered. The informal people have already registered. At this exact time, what we are trying to do is to maintain a database of all these people. And as per the permission of the government and as per the financial concurrence, the plan is to include all these people under the ASI schemes, informal sectors. And it has been going on for the past 5-7 years.
Thank you very much. Dr. Babak, I'm just going to skip over to Swati because this is a continuation of this discussion before I come back to you. And that is, this is obviously going to be a very important portal to get people engaged and get help that they need. But obviously, like we heard in the morning about Tele-MANAS, people don't know about it. So, from the community perspective, what are the kind of linkages do you think that can happen to get people onboarded to this program or to any other programs? And what is therefore the role of civil society organizations as well as philanthropies in terms of promoting mental health and well-being amongst the informal sector, particularly among migrants?
Sure, thank you, ma'am, and good afternoon to everyone. This is a very, interesting topic on which I can talk for hours, but I'll try to start with two brief stories or experiences. One is that there's a migrant family in Delhi where once they came here, they started working in a very, as a household helper or daily wages, but day-to-day expenses were very difficult to meet and husband was also very ill. So, what we do is, there's a whole bouquet of social security schemes which India government has. It's around more than 7,000 schemes, both central and state. So we facilitate access to those schemes. And as a result, when she got access to Ayushman Bharat, her husband's medical expenses were taken care of. Then under ONORC, when they got access to this, through PDS, she could allocate the expense to ensure that her children are continuing education. And also she's going to apply for BOCW card because that will give her a building and other construction workers, which has a whole list of sub-schemes for which she'll become eligible. And therefore, she'll have a better chance at life. So migrants, they will continue to move from one place to another. And largely triggered by distressed migration is climate change that's happening, but socioeconomic opportunities are less in the areas where they do. And when they move from source to destination, they are not moving with adequate documents. So that there's lack of awareness, not only about the government social security schemes, but also about safe migration. So this is one thing we focus on, that whenever these communities are moving, at source we engage with them, which we call pre-departure training, so that they are aware of ways to undertake safe migration. Second story is that of a lot of people, particularly from MP and Odisha and other states, they migrate to Maharashtra, Karnataka, and places to work in brick kilns or sugarcane or cotton farms. Largely, they go through mukaddams or contractors, subcontractors. That happens even in construction work. So what sir was talking about, ensuring that about ESI and EPF, that's really not possible because there are multiple layers of contractors and subcontractors within the construction industry, within people who take them from one state to another, one region to another region. And many a times, because they had taken advance, or even mukaddams had taken advance which is not paid, they become bonded laborers. And whether we agree or not, I think last 3 years that we have been working, we undertook some 3,000 rescues, out of which only 103 got rescue certificates. Because when there's rescue certificates, then they become eligible for compensation and other things. So in rural and remote areas, particularly in formal sector, there is no mechanism for people to approach and seek help for distress or mental health. That last mile connectivity is missing, and that's where we try to help. We work primarily in two broad areas. One is the facilitate access to social security schemes, and through that we have facilitated access to nearly 6.7 million migrant and informal workers. And there's also one component of worker protection, where, focusing on construction work, we are trying to work with industry, particularly construction industry, so that they come up with or upgrade their grievance redressal mechanism, which provides them access to whatever challenges they face, because their complete dependence, working conditions are very precarious, they are given low wages, financial instability is there. So all that leads to a lot of mental issues. Though we have our own dedicated helpline on which we receive on an average of 12,000 calls per month, and these calls, 65% are, these pertain to informational call, rather 35% are related to non-payment of wages or any other such issue related to employer or their own contractors. So looking at the whole ecosystem, we have found that in informal sector, there is a need to, though Interstate Migration Act mandates that contractors should be registered, but that is not happening. And in the absence of that, the employment and other opportunity or other situations they get into are very, very difficult to deal with. So one step is what civil societies can do is facilitate access to last mile delivery and work with government, and like you mentioned, Tele-MANAS is something which has been there because we also receive approximately 200 to 300 calls per month related to mental health, and though we connect them with the Mansathis or one-stop centers or Garima centers, but can we look at linkages to ensure that these get proper attention? And I think a lot of calls also come pertaining to gender violence and women, particularly in these areas, particularly in source and also in work area and destination. They don't know where to go, whom to approach. So it's a lack of, and it is here that we can also come in with that support. Third is also, our ability as a civil society organization to mobilize funds, though very small funds, but for innovation and all, wherever needed, we can support in that pilot and come. Our own experiences are well documented. And, for the helpline, we have our own case management system, which registers each and every case that comes to us, and we do a thorough follow-up on those cases. So I'll stop here, and this is primarily what we do and how we can help.
Yeah, thank you very much. And I think that you spoke on a lot of the, possibilities that are there, as well as the importance of connectivity between that. You also, in my mind, raised another very important issue. And that is, when we talk about mental health, it's not just depression, anxiety, schizophrenia, bipolar. There are so many other aspects to it, whether it's substance use, whether it's exposure to domestic violence, whether it's exposure to repeated trauma, which can cause neuropsychiatric disturbances, whether it's untreated epilepsy, which can lead to other problems, a whole range of those kind of problems related to access and difficulties, and the fact that needs to be also addressed. Dr. Bhavuk, I come back to you to really look at some of the solutions. All these panelists have highlighted the barriers, the challenges, and importance of connectivity and networking. How do you think the Ayushman, Arogya Mandirs, and Tele-MANAS and other such facilities can actually help us to really get this benefit, particularly to the informal sector?
Thank you, ma'am. Before I start, it's an extreme honor to, I think, share the dais with Rajesh Sagar sir and Pratima Murthy, ma'am. And when I got the topic that this was the topic that I have to be a panelist in, I being an academician, I went and looked for research and evidence related to this. And like in the previous session we discussed, the evidence for workplace mental health is low, and within that informal workplace, I think, is literally non-existent. So I went to the next thing. I talked within my department, and I took opinion from my faculty colleagues in the department that this is a panel discussion that I have to go to, and I think some important points came from that. If you look at solutions, ma'am, specifically, the solutions to any mental health issue is mainly twofold, as we all know. It's the preventive and the promotive aspect, and second is the treatment part or the management aspect. See, for a worker in informal workplace setting, for him, health, like Dr. Ankur was mentioning, that health per se and within that mental health is not a priority at all. For them, I think all of us would be aware of the Maslow's hierarchy of needs. And in the Maslow's hierarchy of needs, the lowest rung is the physiological needs: air, water, food, excretion, and so on and so forth, right? So I think for them, the struggle is meeting these basic physiological needs, and from above that, the safety and the security needs, having a shelter. Their children are there who are not able to go to school. The children are exposed to unsafe environments. They don't have a roof for their children, not providing health service to the children. So I think for them, those issues are more important. Those issues are the source of stress. And I think it's important, if you look at the preventive and the promotive aspect, that we somehow try to address those issues. I think the Ministry of Labor is doing this for the formal or the organized workplace setting, but for informal workplace setting, it's laudable that they are looking at it, and that Ishram portal possibly would be a solution to manage it. So I think we first need to ensure that basic needs. For them, I think self-esteem needs and the self-actualization don't even matter. So it's the physiological and the safety needs which they need to fulfill. The second aspect, I think, is within the mental health issues, I think ma'am has already covered. When we see in our OPDs, the clients coming from the workplace setting, Sagar sir also mentioned, they mostly come to us for severe mental health issues, like psychosis or severe or substance use like alcohol dependence or cannabis dependence per se. We usually don't see them coming for stress, depression, or anxiety disorders. Possibly their resilience is high and they don't develop stress or anxiety. That is one theory behind it. Or secondly, maybe they are so tolerant that they don't recognize mild depression and mild anxiety as an issue, and they seek help for that. So I think we need to somehow look at that and change that possibly and analyze that through research or evidence generation. And also I think domestic violence, very importantly, many of them come because of domestic violence, and it's a major downward trend of stress leading to both the perpetration of domestic violence and domestic violence leading to stress also. So I think that's also an important aspect to look into. How Ayushman Arogya Mandir and Tele-MANAS, we are talking about Tele-MANAS since morning. I think Tele-MANAS is a wonderful tool to look into it. And I think we from the ministry, we need to further disseminate the Tele-MANAS number and the facility of Tele-MANAS now with the add-on of video consultation as well and the app as well. Most of us in India have a smartphone, and I think many of the informal place workers also have a smartphone now. So I think the Tele-MANAS can be a very huge opportunity to provide both the preventive and the promotive mental health services as well as the treatment part of it. Ayushman Arogya Mandir again would play a very, very important role. And I was going through the manuals also of the Ayushman Arogya Mandir for this. I think not just mental health, by taking care of the overall health needs of the informal setting. ESI is not covering that as of now. So I think Ayushman Arogya Mandir can pitch in here and provide health services overall to the informal workplace setting. And by taking care of their overall health, I think mental health will itself get promoted and will be able to manage the mental health. It will take care of that second rung of the Maslow's hierarchy of the safety and the security needs by providing good health services. It will reduce the financial burden of health. Many a times they struggle to seek health services because of lack of funding and resources. So services at Ayushman Arogya Mandir are free of cost. Preventive health checkups at Ayushman Arogya Mandir will be an important tool. I think the component of wellness, in a recent meeting, our Joint Secretary Sir Saurabh Sir was mentioning about the wellness package and focus on wellness at the Ayushman Arogya Mandir. I think that focus on wellness at the Ayushman Arogya Mandir, which is taking care somehow through yoga and integration of Ayush, Raghu Sir is also here. So that component I think can be a useful tool in promoting mental health and taking care of mental health of the informal workplace. Then the component of health education and awareness, which is there as an integral part of Ayushman Arogya Mandir, can be used as a tool for both spreading awareness about Tele-MANAS, spreading awareness of mental health in general. And I also would like to tell here that recently we have tried to pilot a newer model in the Ayushman Arogya Mandir, a newer workflow, and we have made that workflow quite easier. And I think going through this, the informal workplace, Neha ma'am, I think that newer workflow will be very conducive for this particular segment of the society as well. So I think we need to look at solutions both from the preventive aspect as well as the treatment aspect, and Ayushman Arogya Mandir and Tele-MANAS will be very important tools for this.
Thank you very much. I think we've really listened to all the challenges, but also some rays of hope in terms of what's happening and where you can plug in for the informal sector. In the last 10 minutes, I'm just going to open it up to the audience. And what I would like is a different expectation from the audience. I'd like you to share with us a couple of innovations in brief, which you think might actually help to reach out to the informal sector. And again, as we said, I mean, we're talking about many upstream factors that can, in the long run, increase vulnerability, the day-to-day hassles that this sector faces, can all increase vulnerability to later problems. So how is it that we can address the informal sector in terms of addressing the barriers and access to care, to mental health amongst them? If there are any suggestions from the audience, that would be very nice to kind of, suggest to the ministry of how this could be taken forward. Yes, please. Introduce yourself and then make your comment, please.
Good morning, everyone. I'm Dr. Swati Ravindra, and I'm an assistant professor of psychiatry in Tele-MANAS in NIMHANS. I was very excited about this panel discussion. It's a very Orwellian discussion, and I was reminded of the saying from Animal Farm, all animals are equal, but some animals are more equal than others. So I really was grappling with the question about who would the final onus of taking care of the informal sector be on. And it really, from my perspective, I think it would really require an elaborate collaboration between the Ministry of Labour, the Ministry of Health and Family Welfare, with such unique innovations such as the eShram portal, Tele-MANAS, we have ABDM, and in many ways this is so unique to our country. And all of it really coming together, I think the onus would entirely lie on us. Sir raised the point of the Maslow's hierarchy of needs. So really the onus would be on us to lead the way and to ensure that mental health comes to them. It may not be more about them realizing that their mental health is not well, and that it would really be on us to show them the way. And this would only be possible through a very elaborate collaboration between, probably an interministerial collaboration as well. So these are just my thoughts on the matter.
Thank you very much. Yes, ma'am. Yeah.
Just one way, maybe we look at the governance, because this local self-governance is one of the institutions. And I think there we can look at how to address the mental health of the informal sector. And similarly in the urban area, if we look at the municipal, urban local bodies, I think because more or less they understand their geography, they also have a kind of a rough estimate that who are all the workers. So I think that is one of the pillars we should be seriously thinking when it comes to the addressing the mental health. And not only looking at the mental health in the silo, and if we look at the health, it's an intersectoral thing. And when we look at the localization of SDG, they talk about the health, and the mental health is one of the components. So it's also important, rather than looking at silo from the health or the labor department, the governance structure is very beautifully created, and if we can invest some piece of that, I think that will be a way of addressing. And my name is Pallavi, I'm from Japaigo. Thank you.
We can take one more comment. Yes, please.
I think most of informal sector is getting some sort of skilling, and I think nowadays with the huge focus of the ministry in offering short-term skilling courses, so it's not actually curative one, but I'm going from preventive side. So when they are offering these skilling courses, whether it's a plumbing, carpentry, because these are all big informal sector. So how do you integrate a small health module which at least gives them basic understanding on health and and including mental health? I think that can also plug in without much of resources or new program and other thing, but that's one of the possibility.
Okay. Very final comment, sir, please. Yeah.
Ma'am, I have a small little example actually. This is from Dr. Arole's comprehensive rural health project in Jamkhed, where I happened to go, and where this Ahmednagar is a very drought-prone district where there were a lot of farmer suicides and all that, and where the female health worker who has been working on the ground in the villages were trained in mental health to look at the symptoms, what we are looking at, the psychological first aid to the villagers out there, and integrate it with the social as well as with the farming practices out there. So that's a very good model actually, if we can actually follow it and bring it about, especially in the rural settings itself. That's my point, observation from that experience.
Thank you very much, sir. I think one should look at it a little bit more in detail, because I think we're talking about integration. So to end this panel, because we're running out of time, I'm just going to ask for a 1-minute intervention quickly from each of the panelists, and then we'll wind up.
I think already we have discussed this, and one of the important thing would be also to informal sector is the what we did not discuss, the safety issue. I think today's newspaper we saw 2 sewage workers had died, and my wife is in trauma center. She says that the Swiggy worker, when they speedily go, they are at the increased risk in the trauma center. So just see that we see that how the safety can be given. The intervention part, I think what we now know that they are the huge population, the proportion is huge, we can't deny it, its health is ignored, and so on. So what we can do, we should make effort to make them realize that health is important, not only for them, for the family also, for the nation. So somewhere we feel that they do not give so much importance to the health. So I think there some efforts can be made to know the importance of it, because having a good health will be helpful to the organization also, because you will take less leaves and so on, your productivity will increase. So somewhere we need to have some program, some efforts from where we tell them, educate them that your health is important not only for you but for the society as a whole. And that, of course, overall health can come including mental health. So I think that will be one of the important things. And also we need to see that whether we can have a special such program, because they are not covered. That is what I said initially, even in the ESI, and of course the portal is there. I don't know how many of them are using those who actually need them. We know that those who actually need them, they are not the one who are using them. So we need to look at some of those issues, and maybe some special program can come up to cater to this particular population. I think that will be important, and with all the multi-stakeholder, let us a different program can come looking at the overall health, and that can benefit them in the future. Thank you.
So we can be very confident when we say that this group of population, the informal workers, are either ignorant about the mental health issues, or if they are not, they fear the stigma associated with the mental health issues. So one of the things that we have done and that we continue doing in our hospitals and the associated organizations and factories is to integrate mental health services with the other physical health services that we are providing. For example, just a brief example, ma'am. There was a campaign where we needed to diagnose and assess the patients with silicosis. It was a Ministry of Health initiative, and it is important to, or it is essential to give the figures of the patients who come to us with silicosis. So we organized a camp in the brick kiln area, where most of the respiratory department went, and one of our senior resident went just to screen those patients for the mental health issues. So we found that there was a significant population who needed help for the mental health issues. We all asked them to come to the center, but I think only only 10% of those who needed help turned up. So it is a good way of identifying patients who need mental health services and interventions by integrating mental health campaigns with the other ongoing existing campaigns which are well accepted.
I'll give an example. Coincidentally, yesterday evening, one of the retired senior faculty from the medical college I work in called me up and sought my guidance to help her maid's son struggling with substance use disorder. She's a maid working in an informal workplace setting. So the question was not regarding that where should I go for treatment, where should I send them for treatment. The question was, is there a setting where he can be admitted without the need of a caregiver, because if she takes him and becomes the caregiver, who will earn the wages for the family? So I think that's the issues that we need to identify and deal with while we are looking at the informal workplace setting. And secondly, since morning in the first session also we are talking about, in general we say that screening as a tool for increasing mental health services or improving the mental health of the population. But I personally believe that promotive and preventive services are more important than identifying and screening services, because the reality is we do not have the infrastructure to, after screening, what to do with those persons who have been screened. So I think that's something that we need to look into, and promotive and preventive services will not give us the numbers of the impact. It will come more as in productivity. Screening will give us the numbers that we have so many persons we have identified, but I think something to be looked into. Thank you.
There are, like I said, many provisions and measures in place. With e-Shram, there's also an effort to link it to One Nation, One Ration, so that migrant workers, wherever they are, they can access food. They have food security as well, in addition to the e-Shram card. But at the sectoral level, there's a need to intervene at sectoral level For construction workers, there's BOCW. There are certain provisions for cotton sector worker. There are certain for sugarcane, but these needs to be more streamlined and all. Overall, for migrant workers, source states from where migration is more, they largely set up a migration resource center, which basically is to equip and empower them or equip them with the knowledge of provisions, what to do, where they're going, a bit of cultural sensitivity on destinations. But in destination, this measure is not there because once they migrate, they are in a geography where language, culture, practices are very different. And to ensure that they get properly embedded, they know of the services that are available and they're able to access those services. Certain measures like enhancing the overall setup of migration resource centers might help migrant workers to assimilate in destination easily. Thank you.
Thank you. Thank you very much, panelists. I mean, I think we've gone through this entire range of discussion as to, what constitutes mental health, whether it's a basic need, whether it's a luxury, whether it's a necessity, whether it's a human right, and the fact that if it's not looked at, our upstream factors are not looked at, we're not just talking about reduction of life expectancy, but also the quality of life of people. And therefore, it becomes very important to have this discussion about reaching the unreached in some ways. We've talked about many of the barriers. We've talked about the needing to look at the holistic aspect of health. We've been talking about the need for mental health literacy to make sure that people engage into getting services. But at the same time, we know that there is a very huge problem in terms of connectivity, in terms of availability, accessibility, and affordability, particularly for this sector. We've talked about some solutions in terms of what exists, what can be strengthened, how the AM and the Tele-MANAS can be useful, but at the same time, how civil society also needs to be engaged in this process. We've also talked about exploitation and safety-related issues, in terms of making sure that this particular sector is also reached out. And of course, finally, I'm just going to end with an anecdote. There was an MP who came to see me yesterday, and he said, a lot of poor people come to him, and they have two expectancies, particularly not so much for themselves, but for their children, and that is, of course, access to good education and access to health. Of course, in terms of access to health, very often it's limited to very severe health conditions, which can make or break, but I think access to health, including for mental health conditions, is a very, very important factor. And I think there have been a lot of suggestions also from the audience, which I think we can put together, particularly in terms of the intersectorality of this particular problem, and especially working with the Department of Labor and trying to see what is it that we can do to strategize that. And of course, from the morning's discussion, maybe working with the Department of Youth, particularly because a lot of adolescents in the informal sector and from marginalized backgrounds have become, there are a lot of these growing problems, whether it's substance use, social media addiction, lack of digital access, which also creates problems for these people. So I think there is a lot of those areas which also need to be looked at. Thank you very much once again to all of you, and over to the organizers.
Hello. Thank you all, and that was wonderfully summarized, Dr. Murthy. I'd like to request Dr. Murthy to felicitate our distinguished dignitaries with a token of our appreciation. We can start with Dr. Rajesh Sagar, Professor of Psychiatry at AIIMS. Dr. Ankur Sachdeva, Associate Professor of Psychiatry at ESI Medical College Hospital, Faridabad. Dr. Bhavak Garg, Associate Professor of Psychiatry, Lady Hardinge Medical College, and consultant NHM, the National Mental Health Program. Apologies. And Ms. Swati Jha, Program Director, Jan Sahas. I'd also like to now request Mr. Saurabh Jain to felicitate Dr. Pratima Murthy. Please stay back on stage for a quick photo. Thank you all. All right. So our final panel of the day will address preventive mental health and the role of holistic practices in promoting well-being. In this session, we'll explore how incorporating indigenous knowledge and holistic practices into daily routines can support proactive mental health care. We'll also discuss the importance of shifting the focus from treatment to prevention, with an emphasis on early intervention to maintain long-term well-being in workplaces. So please join me in welcoming our distinguished chair, Major General Dr. Professor Atul Kotwal, Executive Director, National Health Systems Research Center. Major General Dr. Professor Atul Kotwal is a distinguished medical professional, public health researcher, and educator with over 39 years of experience. His expertise spans health systems, epidemiology, primary care, urban health, and policy implementation. Dr. Kotwal has served in the Indian Armed Forces and advised on public health in Botswana. He played a key role in planning India's 11th fifth-year plan. His honors include the Sena Medal, Vishish Seva Medal, many orations, and over 170 publications. I now invite our distinguished panelists to the stage. Dr. Raghu Arakal, Deputy Director General, Ayush, Director General of Health Services, Ministry of Health and Family Welfare. Dr. Raghu Arakal serves as the Deputy Director General, Ayush, at the Ayush Vertical Directorate General of Health Services, the Government of India. He has also held various senior positions in the Ministry of Ayush, including Joint Advisor. His contributions in Ayurveda have earned him several awards. With an MD in Ayurveda, Dr. Arakal has spent over 2 decades of experience in Ayurveda, public health, and Ayush health policies. Mr. Neeraj Jain, Country Director India and Director of Growth Operations, Asia, Middle East, and Europe, PATH. Neeraj Jain is PATH's India Country Director since June 2016. He is also Director of Growth Operations for India, Asia, Middle East, and Europe. Neeraj comes with over 30 years of experience across business development, marketing, and strategic management in organizations across Asia and Europe. Dr. Yotaru Setoya, Team Lead, NCDs and Comorbidities, WHO India. Dr. Yotaro Setoya is a public health specialist with over 20 years of experience in health research and health systems development, particularly in community health and global mental health. He currently serves as a team lead for NCDs and comorbidities at the WHO country office in India. Previously, as a technical officer for mental health at the WHO's Pacific Technical Support Office in Fiji, he has supported Pacific Island nations in strengthening their mental health systems. Ms. Atika Dhandia, Director, Training, Art of Living Foundation. Ms. Atika Dhandia is a transformational image and personal branding expert, TEDx speaker, and yoga, meditation, and wellness expert. Ms. Atika serves as an international faculty member and Director of Training for the Art of Living Foundation. Ms. Atika conducts empowerment programs targeting elements of yoga, meditation, and breathing techniques, along with image building techniques. She has conducted trainings in more than 30 countries. And finally, Ms. Rabani Banerjee, Head of Growth and Strategy at Arogya World. Ms. Rabani Banerjee heads the Healthy Workplace program in India, along with other Arogya World programs like Healthy Schools, M-Diabetes, Arogya City, and My Thali program. She comes with more than 20 years of leadership and business consulting experience across global multinationals with expertise in employee health and wellness, diversity and inclusion, and organization culture consulting. She's also founder and CEO of a DEI advisory firm called Swaranya, which aims to uplift and champion the strength and resilience of working women through a focus on inclusion. Thank you, and over to you.
Thank you, Ms. Anat. Thanks a lot for making my job easier. And I must say it's a coincidence, but great coincidence that Ms. Anad is the Master of Ceremonies on the World Mental Health Day celebration for which we all have gathered. One of the meanings of Anad is limitless, one without boundaries. So let's have mental health limitless, not in silos, and let it be integrated in all programs and all policies of all ministries rather than only health ministry. So with that, we start, and grateful to ASNMD, JS Policy, and Director NHM2, Dr. Neha here, for giving me this opportunity. A very warm welcome once again to all my fellow panelists. So as we all know that, in the previous panels which we heard in the morning, and also during the inaugural session, we have discussed the important policies and frameworks, National Mental Health Policy, that aims to promote mental health, reduce stigma, foster inclusivity, to prevent and recover from mental illnesses and illnesses. We have also explored challenges, opportunities, and innovative solutions also in informal workplace in the previous panel, which we all heard. And of course, the Tele-MANAS, success of Tele-MANAS, and it's really, we feel very happy that NIMHANS, NHSRC, and IIIT Bangalore, three initially, along with we worked on the directions of Ministry of Health and formulated the initial guidelines, and large, success is really very heartening for that. And all these services are now being part of comprehensive primary health care, and we heard Dr. Bhavuk talk about that Ayushman Arogya Mandir. So I must share with you that in last couple of years, we have had more than 4 crore sessions of wellness sessions, and 55 crore people in the country have attended these wellness sessions. So that's, although it's difficult to quantify preventive and promotive actions, that's why public health doesn't get that kind of mileage or leverage what the clinical specialties get. But here, at least we have the numbers which can later on leveraging technology see that what is the incidence overall subsequently in following years to come. So that's another, success of this Ayushman Arogya Mandir. So that's, this panel will shift our focus to, we have heard what all to be done, what are the challenges. This panel will shift our focus to what is to be done in preventive as such, care as such, the life cycle approach, the primary prevention, secondary prevention, and also tertiary prevention, looking at all levels. And the formal workplace, what we mentioned, we are focusing today, but is also linked with outside our workplace also. Our social networks, our hobbies or lack of hobbies, the social activities, education, intimate relationships, family, peer acceptance, financial situation, access to healthcare. So all that issues also are probably linked with our workplace too, and because they have the effect also if in case the workplace challenges are there. So we need to I would like to highlight two, three more important issues before I start the panel discussion. One is, though we say formal, but as per the information available, there are more than 17 kinds of formal workplaces as such. Each has its own unique challenges. So that's why there's no one size fits all, guidelines or policies which can be there. We need to understand the workplace culture which varies from from one to another. I'm not going to list all those 17. We can have list subsequently as such. Then again, there are various types of employees also. Regular, contractual, part-time, we all know that. Again, each has its own challenges. The kind of, the assured career progression which one set has, the other one doesn't have. This is just one example which I am giving you. Then types of work, we all know, what all various ranges and all, even within the formal. And the other is the prevalence of various factors at the workplace, which were discussed in the previous two sessions. But just to highlight few, the workplace bullying, stress, job insecurity, hazardous working conditions, inadequate support, glorification of the hustle culture which has now come up, workaholism. We all take pride that we work for long hours, and we can contact our team members any time of the day, any time of the week, any time of the and 24/7 to 365. That's something which has become ingrained in us. So and we need to now address those issues also. And it leads to a lot of issues which we all are aware. But the burnout and all which we commonly say, one doesn't even come to know about it. It's a gradual process which seeps in, and suddenly one day you realize what has happened. And of course, the irritability, the minor issues, the stress, depression, and all, which are very common, for which no one goes and consults anyone. That's why Tele-MANAS is going to be a great help for all this. I'm just highlighting that. Substance use and misuse, which can both be a precursor or an outcome as such, and of course impact the life as such. Literature is available. I'll highlight two studies which are there, and I'm warning the data is mentioned. The data are not available. I think two important studies are available. A review of various studies which assess the prevalence of NCDs and mental health in Indian workplace after COVID found that 10 to 53% workers suffered from depression, 7 to 57% suffered from anxiety, and 4 to 76% suffer from workplace stress. The range is large because the study designs were different, sample sizes were different. But one study from Deloitte, one of the big four Deloitte, and which talked about mental health and well-being in workplace in 2022, found that 80% of these workers suffered from something or the other. 59%, most common is 59% depression, emotional exhaustion or burnout 55%, irritability or anger 51%, sleep issues 50%, anxiety 49%. That's a large number. And we all know what happened to 26-year-old employee of Ernst & Young Global Limited recently. On the other spectrum is Mr. Narayan Murthy talking about 70-hour work culture, whereas in Western world they're talking of reducing the work culture, 30 hours, maybe lesser than that, and switching off post, after a certain time every day. So we need to again probably discuss that too here as such. The work culture and the preventive approaches. So I would request all my fellow panelists to when they share their ideas, that they focus on broad principles which are solution-centric, action-oriented, and innovative. Because we need to come up with a plan after this session that how it is to be done, what is exactly to be done here. So I will start with Dr. Raghu. So if you could kindly elucidate that what is the role of government policies or programs, initiatives and healthcare facilities in promoting indigenous practices and holistic approaches for mental health mental health at the workplace. You could also probably add the 12,500 odd Ayush arms. What is specifically being done there?
Thank you. Eminent Chair, Professor Atul Kotwalji, other co-panelists. It is a really very important issue that we are actually discussing, specifically in the context of preventive and promotive aspects of mental health, where how the traditional medical practices as well as other cultural practices have, how it can become an impact in defining the health outcomes in the context of the mental health. So as far as the national policy itself is concerned, actually there is a very specific action is actually provided. To integrate the yoga at the workplace, to integrate the yoga in the schools and other places wherever the community platforms are available, that integration is to be effected. As far as even the Mental Health Care Act 2017 is concerned, actually even the traditional medical systems, the Ayush practitioners are also, their institutions are also part of that. So in this context, actually, what the Ministry of Ayush has taken over the last 1 decade, you may be knowing that yoga has been popularized enough, even not in the country, even throughout the globe. International Day of Yoga has given that kind of momentum. And after that, customized yoga modules have been prepared by our prestigious institute, Morarji Desai National Institute of Yoga. For example, for the ideal, which is very ideal to the workplaces, this 5-minute Y break. So we have developed this module and to considering the needs of the diverse workplaces, whether it is in the corporate sector, whether it is in the small scale or medium scale industries, and where even the limited number of people are actually working. So every setting, even without consuming lot of space, actually this Y break can be easily accommodated. So we have also gone into details of how this can be affected, particularly in the context of whether it is simple asanas, pranayamas, or even very small relaxation techniques which can be adopted in the work setting actually. So based on that, whatever inputs we received actually, it was actually now practiced widely in many of the private sector institutions also. So we are very happy to know that even in the government departments also, Y break has been easily accommodated, and even after many of the meetings, actually Y break has been regularly now practiced. That is one point. Another one, Professor already mentioned about the Ayushman Arogya Mandir. Ayushman Arogya Mandir, particularly what we call it as Aam Ayush, we have implemented in the country to a robust beginning of 12,500 Ayushman Arogya Mandir. Out of that, we have deployed actually one male yoga instructor, one female yoga instructor. So their role is very specific in the context, for example, the community mobilization. Whichever community platforms available at that level, whether it is a Panchayati Raj institution community platform, whether it's in the schools. So they will have that kind of capacity building to the people about day-to-day practice, how they can integrate yoga into their day-to-day practices. Another one is specifically at the institutional level also, whatever the advisors for the healthy well-being, whichever is required for that purpose, that is also part of this Ayushman Arogya Mandir. So we are also, because we have already discussed with even Adulji also, we have discussed very specifically how the wellness component can be integrated into the whole set of Ayushman Arogya Mandir. And I think already we are actually conceptualizing that part also very specifically. And we can clearly define which are the wellness components which have a cross-cutting, not only in the frame of the mental health, even NCDs and other NCDs and other lifestyle disorders, everywhere how this wellness component can be integrated. And another point that I would like to say that a lot of studies have already been undertaken in this context. For example, this Center for Integrative Medicine Research, CIMR in AIIMS have actually undertaken a large number of studies, specifically the advantages of the yoga in different segments of the society. For example, whether it is in the pregnant ladies or even for the reducing the clinical depression. So all these findings very positively is giving us an impression that the yoga as well as other wellness aspects has to be widely inculcated into the community. And on that ground, actually, Ministry of Ayush recently conceptualized the Har Ghar Ayur Yog. This is a program that we are envisaging to take this program into the household level. Wherever this yoga and the lifestyle advisories of the Ayush, whether we can bring into the household level. For that, in a convergence mode, we propose it as a convergence mode with the different ministries, different organizations, different departments of the entire armamentarium of the government, even including the private sector. We would like to extend that program into the household level. So I think comprehensively the mental health also will be one of the target when we speak about Argar Ayuryo.
Thank you, Dr. Raghu. I'm tempted to, add on to something, but I think I'll reserve those comments for my later initial, final concluding remarks because of the paucity of time. So, Mr. Neeraj, you are as country director in PATH for India, and also your role, which extends beyond India, actually, the Africa and a lot of South Asian countries also. You're the right person to answer that, how does one ensure improved access to resources and services for promoting mental health among employees and also society at large?
Thank you, sir. Thank you for inviting me to this conversation, sir. And it's always wonderful to have a conversation with you. So I'm really looking forward to it. I think I just want to congratulate the Government of India and the Ministry of Health for taking this issue as front and center, very important part of the conversation, and recognizing the need for work in this space in the primary health centers from a health equity perspective, because PATH focuses on health equity, and there are many people who actually don't have access. So thank you so much. I think it's the beginning of the solution is actually recognizing the problem. And for me, the fact that we have recognized it at the national level, at multiple states, and gone down all the way down to communities, I think that makes a huge difference. Coming just from the question and the workforce perspective, it's a very interesting thing, but the same Deloitte reports that you just mentioned also kind of estimated that financial losses from conditions relating to mental health could be up to about $14 billion a year. Now, we don't know whether these numbers are correct, but clearly there is an issue because of mental health challenges and absenteeism, attrition, etc. And there is a huge need for organizations, for companies, for societies. I mean, it's an important thing to actually recognize and start intervening. From our experience from across the world, what we are learning is that the biggest challenge really is to have resources available when and where they are needed. So how do we get reliable, accurate, easily accessible resources when needed for mental health care? And mostly around self-care, actually. So I think the focus should be resources which will help individuals think about themselves. We also need a lot of programs like this, also at the community level, for awareness and identification and management of stress, because that's one of the big triggers that we are seeing in this space. Treatment resources, what is the continuum that we are offering? Where does one go when one's identified? And I think the last panel they talked about that screening by itself, we may not be doing justice to the entire process. There's going to be a lot of training, and I know that I know about the training programs of the Government of India, so I won't go much in that. But in terms of even organizations, just training around what could be the triggers, what could be the causes, what could be the possible solutions, and really ensuring that those practices are watched and controlled, I think is going to be absolutely critical, and that's something that at PATH we really focus on globally. I think, one of the other things is the vulnerabilities and the cross-cutting, general nature, gender, age, socioeconomic background, job type. We all come from different backgrounds, and there are differences in the way that we respond and the way we act. So I think that is absolutely critical when we are developing any kind of work-related programs, etc. I think that's going to be very, very important. Then I'll come to some basic hygiene practices, and you talked about workplace bullying, stuff like that. I think we just need to create a culture of a safer workplace. I think that's absolutely critical, where job insecurity is reduced ideally. Workplace isolation is, we ensure that that doesn't happen. How do we create programs for supporting individuals who are actually going through a crisis? That's another important piece. How do we rehabilitate some of these people back into life? I'm a big guy. I've been following Mr. Tata for as far as I remember. And I remember there's one saying of his which kind of stuck to me, and I'd like to remember him with that. And he says there is nothing like a work-life balance. It's work-life integration. You know, how do we integrate our work and life and not really get into this hustle? And how do we balance that? I think that's an important piece. So I'll stop there and pass on. And but lots of other ideas.
Thank you, Mr. Neeraj. I'll come back to you again. I think if we manage to, complete our first round in time. So, Mr. Yotaro, with your experience in island nations earlier and now in India, if you could share, what are some of the lessons learned from global practices that may be relevant for the Indian context while utilizing the indigenous approaches also for the workplace mental health issues.
Thank you, Professor Kotwal, and thank you for involving WHO for this very important day, World Mental Health Day, and for this panel. When talking about workplace mental health, we need to think about a holistic approach. We cannot think only about mental health, but we need to think about physical health, emotional health, and social health. And so we need to make a comprehensive strategy. And also, when implementing in different parts of India, we need to think about integrating the evidence and modern protocols with the traditional or culture appropriate interventions. So starting from the evidence, WHO has recently in 2022 made a guideline called Guidelines on Mental Health at Work. And we did a rigorous evidence review. When WHO tried to make guidelines, it's a very lengthy process of going through all the different evidence, and we tried to come up with a concrete recommendation. What we found out is that we still need a lot of research in this area, and many of the recommendations are still at the kind of a weak level, but still we have a list of recommendations. So I will try to frame my intervention through that recommendations. So there's broadly three recommendations, three areas. One is to prevent, second is to promote, and third is to support. First one is prevent. To prevent mental health issues, conditions, we need to reshape the work environments to minimize the psychosocial risks, stresses, to prevent workers from experiencing mental health conditions. For that, there are some recommendations, including providing flexible working arrangement, involving workers in decision-makings about their jobs, modifying workloads or work schedules, for example, limiting work hours or shifts, and if they go over time, they should have a proper way of compensating for that time. So that enables workers have a better work-life prioritization or work-life balance. So we need to value the workers' rights to make sure that they are safe. As I mentioned, we need to make sure that there is a culture of safe workplace. I think there's so many things happened during COVID. There's many private companies, including also WHO, offering flex time and work from home arrangement to their employees. And of course, we need to. There's not only good thing about that. There's some cons as well. But at least for mental health, it's proven to be beneficial, and especially for women, empowered women's inclusion in workforce, as many women sometimes needs to take care of their children or elderly. So if we give an option of flexible work arrangement, it will also empower women and also enhance mental health of the people, of the workers. Second recommendation under this is preventing violence, harassment, and discrimination. Yes, we need to foster a culture of a safer workplace. And I'm from Japan, but I remember Japan, we also had a lot of issue with power harassment, sexual harassment at workforce. It was very common in Japanese private companies, but it's slowly changed when the private companies make a system to actually, to reporting, and also making a penalize those who use their power for power harassment or sexual harassment. They are actually penalized or they were asked to leave the company, so there is a system for that. So we need to make sure that this measure is in place. The second area is promote awareness, skill and opportunity about mental health, to understand about mental health issues, and promote mental health of our workers. So the recommendation is to train the managers and also the workers about the knowledge, attitudes, and behavior about mental health, but also where to access mental health. So those kind of training is recommended, and there's a lot of different trainings, including mental health first aid training, which is happening in several countries. Similar to physical first aid training, everybody should know what to do when we encountered mental health issues. So there's a training called mental health first aid training. There's also a campaign in Australia called Are You OK campaign. It's a very simple campaign. There's a one day in September which asks all the employees, all the workers to check in each other asking, are you okay? And try to listen each other, to foster a culture of listening to each other, checking in each other to know more about how they're doing and to foster their mental health, enhance their mental health. Also, there's a lot of, another area we need to do is recommendation is to provide psychosocial intervention to build worker skill in stress management, and also to act on those issues. One example, especially for informal sectors, in Zimbabwe, they established what they call a friendship bench within the community, where trained lady, they call them grandmother, they're trained in simple problem-solving techniques, and anyone who's have time can go to that bench and discuss about their issues, and the lady will give a very simple advice based on the problem-solving techniques, basically to brainstorm and together and give some advice. Other thing is to provide opportunities for physical activity at the workplace, such as yoga or any sports, aerobic training, walking, etc. at the workplace is a recommendation under the second area of promotion. And third one is to support. We need to support workers with mental health condition because it is, as you mentioned, Dr. Kotwal mentioned, there's up to 20% of people who have experienced depression in their lifetime. So there should be a system that once they have depression, there should be a system at the workplace to support them. And also there should be a way to accept them after they have some rest to return to work. So there should be some system called return to work program. So overall, I think it's important to create a supporting environment. And there's a lot of global practices, but it needs to be adapted to India's cultural context. India is a very big country with different cultures, so we need to think about regional, religious, gender, or migrants, etc. That's kind of different needs to cater and adapt these interventions. Thank you.
Thank you, Dr. Utaro. Ms. Atika Dandia, in fact, since morning we have been hearing the term workplace culture and all.
That's right, yeah.
So what are some most effective ways to promote this kind of positive workplace culture? And your inputs not only for the employees, but also for the employers, for that using holistic approaches for addressing the mental health issues.
Right. Thank you. First of all, let me wish you all a very happy Navratri. This auspicious 9 days, and today is Ashtami. So it's a glorious day for all of us. We are a young nation, sir, yes. And most of the people who are now studying in colleges and schools are going to be the leaders of tomorrow. So first of all, as everybody else has said, I think awareness is the first thing that we need to start with, yes. Number two, this is the day and age of heavy social media with the youth. And when we talk about prevention, we are talking about that young population which is working. And they are day and night engaging in social media. So apart from Mr. Narayan Murthy, we also cannot have our top actors of our country. I just saw a YouTube video short of one of the top actors of our nation. I don't want to name him. He is like a heartthrob of the nation, and he's talking about that I don't eat and sleep, and that is how I attained success. So we need to somewhere be aware of what we are talking. Yeah, we need to, if we are leaders, yeah, we need to be aware of what we are speaking, especially in this day of social media. So there, as you said, leaders, people who are the inspiration for the youth, whether they are in the company, outside the company, Bollywood being the soft power, the politics, the politicians, everyone who's up there and leading the nation have to be made to be little sensitive of what they speak and how they speak. And number three, it is not about integrating yoga and wellness in the corporates. Yoga and wellness should become a way of life. It's about prevention rather than cure. Yes, we should be encouraging the employees, the workforce to go for regular annual detox. That's the only way. You know, you can't eat a homeopathy medication or an Ayurvedic medication if you've not detoxed the body and mind. So at least 4 days in a year, take off, switch off your phone, go for a complete detox. Switch off your iPads, your laptops and everything. This is what we need to encourage, and this should have a trickle-down effect. The top leaders in the company should be doing it themselves, and then only will they make it compulsory for the young ones in their companies, at their workplace. So I can go on, and there's so much to learn from our practices, from actually not only India, for example, Japan, forest bathing. It is such an amazing thing. It is encouraged that 4 days they take off and go into a forest and live there. We have Vriksh Ayurveda here. Yeah, which is also the same thing. We can encourage the corporates to go for more nature retreats, having their meetings in a more natural surroundings, spending time more with nature, and create green spaces in the office. Give people time for grounding, walking barefoot on the grass. Yes, 4, 5, 6 p.m. when the vitamin D is also maximum. It's in the morning and in the evening also. Encourage grounding. Tell them to go off. Take 10 minutes off. Go and ground. Walk on the grass, if possible. I mean, these are small little things. Teaching them about self-abhyanga. Yeah, because vata increases when you're sitting in front of the laptop throughout the day. Your air element increases. You will not be able to go and have a good sleep in the night. So self-abhyanga, that is an oil therapy just before bath, if you can just self-massage your body, it'll help to bring the vata down. They'll work better, they'll sleep better, they'll be fresh the next day. So these are very little things which we can incorporate in the work culture. Yeah, I can go on, sir, but there is...
Thank you.
Yeah.
Thank you. Thanks for illustrating all those points. So, Ms. Rabani Banerjee, if you could, illustrate what are the challenges, barriers, as well as enablers at the workplace in terms of adopting these preventive measures, which have been mentioned by your previous speaker as well as many others since this morning also, and any tangible changes if you have seen where these have been adopted.
Sure. Thank you so much, and thank you, Ministry of Health and Family Welfare. And it's such an honor to be here amidst this, esteemed panelists. So I have worked with, hundreds of organizations for the last 20 years, and I have seen a span of different kind of experiences. I'm going to share some real examples from the companies. We've heard a lot of, data from different external sources, a lot, and I'm not going to repeat all that. So one example I want to start off with is outside work, with your permission, sir, is Finland. Have you all heard of this country, Finland? What is it known for? They're the happiest country in the whole world. And they broke a stereotype some time back. And what was it? Anybody? They had a youngest prime minister in the whole world, Sanna Marin, at the age of 34, a woman prime minister. And Finland was a country which had the highest suicide rates. And today they are one of the lowest suicide rates. And they have been last 5-6 years, they have been the happiest country in the world. And I know, you can go back and check amazing practices they have adopted as a government, as a society, as a community, as an every individual, as a stakeholder towards that. It can never happen. Mental health and other kind of problems can never be solved by any one particular sector, right? Everybody has to come together. So the good news is that every problem has a solution, right? So we are talking about India and corporates. So in corporates, we heard a lot about the Deloitte data, I think actually it's like so many $1 billion it's costing the world. But what are the employees saying? So I did some research and found out some data. I'm going to talk about, everybody is talking about the impact and what we can do, but what is it that employees are saying in India? The research was done, 3,000 employees covered across 8 cities. And I'm going to just share 3 alarming statistics. 9 out of 10 employees are saying that they lack work-life balance. After so much of talk around mental health, COVID, so many awareness sessions that we are doing, and so many conferences happening, right? 9 out of 10 employees say that they do not have work-life balance. 80% of women are saying they face stereotypes at work, being unfair practices and biases. And 90% of employees are saying that they are expected to work even while they are on leave. And I'm sure all of us will agree to that, right? Most of us here, that we are all the time working, even we are on leave, even if it is a planned leave, vacation, there's a crisis management going on. So net, I believe that mental health, we all talked about it, is a human right. It is an integral part of our overall health and well-being. And however, there is a paradox. So we all know post-COVID, a lot of discussions happening and so much of awareness has gone up. But there's a data that talks about, are employees comfortable about sharing their mental health with their leaders and managers? Do you think that number has gone up after all the awareness sessions has happened? How many of you think it's gone up? And that employees are more comfortable about talking about their mental health with their leaders, managers, and organizations? None of you think it's gone up? No? You think it's gone up? Okay. So the real data says, so the paradox is that it did go up post-COVID, all right? But in 2023, a paradox emerged. The actual number actually went down to half, from 37% in 2021 to 19% in 2023, and it's declining. So definitely there is somewhere we are going wrong. We are doing a lot, but there is a root cause of the problem which we are not solving. And as you know, it's not a problem today, as the CHRO of one global organization said, that it is a looming human energy crisis that we are working towards, right? So how are we doing as corporates? As corporates, again, data says that 1 in 10 employees have access to employee assistance programs, and not even 1,000 companies in our country have a structured EAP, is what they call, right? Employee assistance programs. And guess the companies who have a EAP, what is the utilization percentage? It's as low as 2 to 5%. So there's a lot of stigma around mental health, right? And I'm going to just quickly talk about some framework that Arogya World has developed. And it's like, it's a holistic it's a holistic framework, healthy workplace framework, where mental health has a huge, good 30% weightage, and it helps companies adopt the framework and get certified at different levels of bronze, silver, gold, platinum. And platinum companies have seen a huge, significant impact on real data. So companies who've adopted are doing well and working on mental wellness have seen actually, workplace stress going down and sleep hygiene of employees going up, their productivity going up, they feel safe, psychologically safe at workplace, and so many metrics, actually it's translating into good habits, right? So there are three stakeholders. I'm going to conclude with three things that organizations need to work on, and as you, Dr. Kotwal, you started the note on a absolutely bang on point that there is no one size fits all. Many organizations feel that creating, workplace wellness means doing Zumba sessions, right? So, however, it's very important to know that every organization is unique. They have their own challenges. Sometimes, if an organization, the location is very remote of the company, employees are struggling to reach there, that is impacting their, health. You rather give them a good transportation facility than doing any Zumba session, correct? So, end of the day, we need to customize and address the issues what employees are facing at work, and it will be absolutely different from company to company because there are small, large, different industries, different context, every company that has, and the leaders have to address the real issue, which will differ from company to company, and they need to really customize. For example, Indian Oil has come up with a happiness index instrument, and all employees go through and they're able to act on preventive measures because before a problem becomes catapults into a larger problem, they're able to nip the bud by taking those actions, right? And they monitor it like a dashboard, they monitor it every day. And they have, like there was an issue on performance appraisal, and they were the first public sector to make performance appraisals transparent. So everybody knows who's got what rating. Anybody can go and ask a question to their manager, why did I get this rating and somebody has got a better rating? Why is he getting promoted and why is he getting transferred and so? Look, every question will be answered, right? And that's how they have created that culture. And they have done a lot of initiatives around creating more inclusivity, and they have even hire all the sports people who do not get job after retirement, they give them employment. There are women prisoners who come back and do the manning in the petrol pumps, and so many, cases. CSR employees are doing a lot of CSR work. So that is a holistic approach they have taken. So 3 levels organizations work on the leadership level, where leaderships have to champion, have a dashboard, and work on every metrics, health metric, just the way they look at profitability and customer score, they have to also look at employee happiness and employee health and mental health, right? That becomes a core of their philosophy. Second, every managers, as all of you said, have to be trained, and they have to take care of their employees. Some companies are training managers on family supportive behaviors because research says that employees, a lot of family, what is going on impacts their mental health, beyond their work as well. And lastly, all the employee-friendly policies, a lot of organizations that work on, and we've already spoken about it. How do you create sexual harassment policy, or be it giving flexibility, work from home, and many other friendly policies to make it a better experience for employees, right? And I'll end with one small example of Google. What they did is they had a lot of work-life balance issues because employees would spend a lot of time in internal meetings, and they came up and said that only 20 minutes meeting we will have. Come prepared, send everything in information, come read. You have to conclude and make a decision in just 20 minutes. That's it. Thursday, no meeting day. Nobody can hold any meeting on a Thursday, right? So many examples like that, and I think it's a mix. When we talk about prevention, it's a mix of intent, the policy, but also every manager has to make it happen, and as you rightly said, leader has to role model the right behaviors. Otherwise, nobody else is going to, culture gets driven from the top, right?
Thank you, Ms. Ravani. Timing again, whether in formal industry or in panel discussion, are very important. And although we started at 1:15, we have 15 minutes officially. But since we have a summing up session by JS policy and followed by lunch, so I think we'll try to save 5-7 minutes of that time. So instead of 3 minutes, which I earlier discussed with you all on email, in one minute, if you can answer the second part as such. So Dr. Raghu, if you could share some innovative or best practices in your area of work or even prior appointment in work setting.
What we would often think that the most difficult aspect of changing the behavior as far as even in jails actually. Ministry of Ayush actually in the Tihar jail we have introduced the yoga sessions and for continuous for 6 months actually we have followed and it was found that actually even the normal level of the anxiety and even other aspects of the well-being has clearly addressed. Whereas in the case of depression, it has not responded to that extent actually. So this jail, as an example, many of the states, particularly Assam and other state governments, has taken and they have also introduced yoga in the jails. So what we want to make a message that actually if such a yoga sessions can have that kind of well-being and mental health impact even in jails, why can't we make it into all the establishments, whether organized within the private or government sector? So that itself have certain kind of momentum.
Thank you, Dr. Raghu. So, Mr. Neeraj, same question to you with a slight twist as such, since you are PATH stands for technology in health, and you are one of the experts in digital health now. So, if you can add into this, how technology can be leveraged for this?
Thank you, sir. I think, and we're all hungry, I think, so I'll be very, very brief. I think, because of the stigma and inequity attached to just intervening in mental health, we ran a challenge. We looked at all the possible solutions that could be rolled out, especially in places where there are low resources. And I just want to name a few quickly. Visa is a Bangalore-based one which has an AI-powered life coach, for example, and that helps users manage emotional health. Tele-MANAS, of course, we've been talking about it. Fantastic platform, without any cost, 14 lakh calls in 2 years, and I think there are many such platforms that are needed. In Myanmar, there's Therapy Mantra, which does a similar thing, and in Bangladesh, there's Boner Bandhu. We found these two solutions which are creating mental health support avenues. Smart Health is an app with self-assessment, early detection, and teleconsultation for mental and physical health. Happify Health, another one which is looking at driving positive behavioral changes and manage conditions like depression and anxiety. So there are many such solutions out there which will help, so mental health is accessible to most of us who can afford it, but how do we make it affordable or free? And those solutions will probably come from the digital side, and that's what we are focusing on.
Thank you, Mr. Neeraj. So, Mr. Yutaro, you gave an example of innovation best practice from Zimbabwe. So, if you could, share any other innovation or best practices subsequent to the WHO's, 2022 guidelines on mental health at workplace, if you could do that kindly.
Okay, thank you. Maybe. I think general awareness, maybe thinking about general awareness about depression, I think there's still room for improvement. Maybe good practice can be from New Zealand, where they launched a Like Minds, Like Mine campaign. This is about the depression campaign. And they used a champion, John Curran. New Zealand is a rugby country, yeah? So rugby, he was the All Blacks captain, John Curran. But he was suffering from depression while he was a captain. He made a small mistake in rugby, and he became depressed. And he talked about his experience, what he went through when he was playing matches and things. And this was very successful in raising awareness about depression, that anyone can get depression, and even a strong man, the All Blacks man can get depression. So this is one of the very successful awareness campaign in New Zealand that really increased the awareness about depression and importance of receiving treatment. So yeah, that's one example.
Thank you very much for the example. Ms. Atika Dandia, if you could share what are the just one or two important challenges which you face as a wellness consultant or corporate settings and all when you go for training. What are the challenges you fail and how you manage to overcome those?
So I feel really fortunate now that I can say that at least now the corporates have a wellness budget. Earlier we used to go, there used to be leadership training budgets and there was nothing like a wellness budget. So we've come a long way and I'm really glad about that. And the only challenge I face now is we give them the training, we make them aware, but they go back to square one again and again because there is lack of follow-ups. So I think this needs to be taken on in a very consistent basis. There needs to be community support, which is like a, drawing from the Indian tradition of strong community bonds, peer counseling, sharing experiences with each other should become like a common thing. And one thing which also where I have experienced a little problem while I have trained people is nothing is kept, like the food in the cafeterias does not change. They're having highly processed food all the time. So however much I train them in yoga, meditation, detox, they go back to the same place again and eat all that maida and oil and fried and whatnot. So going back to that thing needs to be changed. They need to be given more healthy food while they are at work. So this is something which I've faced as a challenge. Yeah.
Thank you for highlighting that yoga is beyond exercise. Yoga is much more than that.
Absolutely.
Yeah, great. Thank you. Ms. Rabani, just quickly, although you shared few of your innovations and all, just one or innovative practice or best practice which you've come across till now.
Sure. So I think two things I would like to share that what organizations could do is one, there is a very powerful instrument called DAS that, I don't know if you've heard about it. It stands for Depression, Anxiety, Stress Scale. So organizations use it. It's like a lead indicator. And before anything worse happens, you can know that, okay, there are pockets of problems and you can immediately have some preventive measures to thwart that, right? So that has been used by many some of the very best workplaces, and they've been able to move the scale from high to low, right? The lower the scale, the better it is. Second, I think a lot of anxiety that is coming today is from job insecurity, and there is an overload of work and some, I think all of you will vouch that people who are the high performers, they are loaded with more work, right? So some kind of check, there is a technology, digital platform which gives you an overview of people who are overloaded with work, who are working more than 18 hours a day. There are so situations, how are you able to identify them and stop it from happening? There are organizations who follow that 7 o'clock lights off, right? Means no work. Weekends, no discussions, no meetings. So some of these have to be really implemented using digital technologies, big time happening, because it helps you identify the pockets of pain and immediately launch some preventive measures.
Thank you very much. So I am not, summarizing what all you said because we leave that to JS Policy sir in his session for summarizing all the panel discussions. But just quickly, a few of the important ones, I think before I go to a few bullet points. One is, as we mentioned, customization for each as such. Similarly, customization for our own country to begin with, because we can't compare ourselves with the Western developed world. They're socioeconomic, they are somewhere else. And we are, even though we are fifth economy as such, but per capita, we all know. So the challenges which are available, the kind of number of people available for one particular job. So that also puts a lot of pressure on people who are already employed to work as such. So we need to look at that those conditions for comparing from the Western world, and then tailor-made make our solutions ourselves as such. And when we come to individual, I think each one of us has to find our own mojo, as they say. For everyone can't be doing a yoga or go to forest and all, but I may take out my stress by playing some game or someone, or even just that vibe break as such. So it depends on each one, And that's where we need to probably integrate mental health in all our aspects of work culture as such. So work timings, I think I would like to highlight is very, very important. Work as a priority over other aspects of life. That's why the work-life balance, or very rightly said, work-life integration. We need to discuss formally and informally within our formal workplaces as such. I think one point was missed out, the professional relationships, I think. That somehow, I think, got missed out in this discussion. I'm sorry if I missed out in listening to you all. We all develop professional relationships. It's a double-edged sword. It is very helpful because you can vent out your feelings and you can share your feelings. But sometimes, because of oversharing also, that could be utilized or misutilized and come back also. So we need to be careful on that, but at the same time, we need to have healthy professional relationships. And the hierarchies which are there, how we can break those for particular events or particular issues as such with an open door kind of policy. Like in NHSRC, we have an open door policy. It's not that the consultants will come through their advisor to me for any kind of personal or professional issues. Anyone can come to my office and anyone can go to any advisor's office instead of going through senior consultant or lead consultant. So that's just one example which I am sharing with you. Talking about mental health, and that's I think we need to do regularly. The inclusive system, again, which has been mentioned by everyone. The divergence and all we mentioned as such. So I'll just give you one example as such. I know, I was in the army as a brigadier. I was adjudicator of the disability pension. That is given to individuals, or even after, if someone dies in harness in service, to the family pension is double than the actual amount of the normal family pension amount. There was one case of suicide. It was one of the rare cases of suicide where the family got benefit, but which was attributable to service. There was one equivalent to the junior commissioned officer of Air Force. He was for one specific trade, and in that Air Force station, there was only 2 people of that particular trade. He was somehow denied work in that trade, and he was put on guard duties regularly. So the case came to me eventually that so-and-so suicide happened, and the suicide is not attributable till date in our government regulations as such. But when I read the entire noting, I went into details and all, I read the court of inquiry and all, and then we read the suicide note and all, where he written clearly that I approached so-and-so and so-and-so date and all. And he wrote clearly, कि मैं उसके पास गया, मैं उसके पास सबने मुझे चाय पिलाई, बिस्किट खिलाए और भेज दिया. So for 1 year, he was under stress that I am not doing my actual technical job for which he was qualified, and he was doing a general duty job for which that qualification was not even required. And he was being quoted by other people who were not that qualified. And Air Force has got very, very highly qualified people in those technical skills as well, because of the machines which are there. So eventually we fought with the system as such. I was the adjudicator from medical side, discussed with the non-medical thing, then we went to the Adjutant General also and presented the case, and somehow we couldn't help him during his life as such, but at least his family got the disability pension, which was made attributable to service. So we need to look at each and every case. We need to probably have that kind of channels open where people can go, and then action is to be taken, and that needs to be diaried. Even though armed forces has that, but sometimes there are breaks as such. So I think I'll stop here, but just before that, I must thank my own team in ED Secretariat for doing the literature review, and also they have made a very good acronym of PAUSE, P-A-U-S-E. P is encourage employees to take out time when needed, asking them to step away from stressors and promote a culture that values work and time away. Assess, regularly check with employees about their mental health and workload. Unwind, provide resources and opportunities for employees to unwind, wellness program, mindfulness sessions, indoor-outdoor activities, anything, team building activities. Solutions, explore the solutions available to employees' challenges, whether adjustable workload or professional development or like work from home or any other kind of solution, and evaluate. Have an inbuilt system of evaluating your activities and also employees' workload stresses and all also. So with that, thank you very much, all the panelists. Do we have 2 minutes for 1 or 2 questions, Dr. Neha? Just one or two important questions or comments, or sharing your this thing from the audience, please. I think everyone is hungry now. So I think we thank you very much once again, and thanks to Ministry of Health for this opportunity. Thank you.
Thank you all for this really critical conversation. I think it's a conversation full of nuance and layers, and that can continue. I'd like to invite Dr. Kotwal to felicitate our dignitaries with a token of our appreciation. Dr. Raghu Arakal, Deputy Director General Ayush, the Directorate General of Health Services, Ministry of Health and Family Welfare. Mr. Neeraj Jain, Country Director India and Director Growth Operations Asia, Middle East and Europe, PATH. Dr. Yutaru Setoya, Team Lead, NCDs and Comorbidities, WHO India. Ms. Rabani Banerjee, Head Growth and Strategy, Arogya World. And Ms. Atika Dhandia, Director of Training, Art of Living Foundation. May I just request you all, may I request Mr. Saurabh Jain to please felicitate Dr. Kotwal with a small token. Please do come in front for a photo. Thank you so much. Before we close this event out, we thought it would be important to provide you all with a small meditation tool that you could also use in your day-to-day life, whether at work or at home. Ms. Dhandia, if I may request you to initiate the meditation, would you like?
Okay. Sure. All right. How about a quick one? Yes? Are you ready for it? Yes? So, it is a very good idea always, before you eat, you go from the fight and flight mode to the rest and digest mode. And meditation helps you to do that. Yeah? Ready? Let's just sit comfortably and easily. Relax yourselves. Sit back. Do not cross your legs, your arms, and just close your eyes. Take off your glasses, put them on the table. And let's close our eyes. Take a deep breath in and breathe out from the mouth as if you're breathing out from a straw. Take another deep breath in and breathe out from the mouth as if you're breathing out from a straw. Purse your lips. Let the breathing out be longer than the breathing in. One last time. Let's take a breath in and breathe out from the mouth. Relax your feet. Relax your legs. Relax your abdomen and chest. Relax your shoulders and arms. Relax your neck muscles. Loosen them up if you want to by moving it. And now relax all your facial muscles. Your lips, your cheeks, your eyes, your eyebrows, forehead, the top of your head. Relax your entire body. Relax your entire body. Your entire body. Take another deep breath in and breathe out from the nose this time, very slowly. One more time, take a deep breath in and breathe out. For a few moments, I want nothing. For a few moments, I do nothing. For a few moments, I am nothing. Achaha akinchan aprayatna. Drop all efforts, mental and physical. And completely repose in the self. शारीरिक और मानसिक दोनों चेष्टाएं छोड़ के सिर्फ विश्राम करें. Astoma sadgamaya tamsoma jyotirgamaya mrityurma amritam gamaya. Om Shanti Shanti Shanti. The body is still and the mind is getting stiller. Take another deep breath in and breathe out. Taking another deep breath in once again. Become aware of your body and surroundings. वातावरण और शरीर के प्रति सजग हो जाएं. And taking your own time, very slowly, gradually, you may open your eyes. समय लेते हुए अपना धीरे धीरे आंखें खोलें. Take your time, do not be in a hurry.
Good morning. Good? Was it good? How many of you felt relaxed? Yeah? Now the food will get digested better. Enjoy the day. Thank you.
Thank you so much. Now that we're all relaxed, it's time to reflect on the key insights and look ahead at the next steps. To deliver a summary of the sesh for the entire event and share some valuable pointers on the way forward, please join me in welcoming Mr. Saurabh Jain, Joint Secretary Policy, Ministry of Health and Family Welfare.
Respected dignitaries, esteemed panelists, and distinguished guests. So it's been a very productive forenoon session of lots of panel discussions. Lots of insightful discussions has happened during the last three and a half hours. Now it is very important to reflect on the key takeaways from these sessions and to chart a path forward for mental health in the workplace. The discussions we had today underscore the critical need to prioritize mental health not just as a healthcare issue, but as a fundamental component of well-being in both formal and informal workplaces. In our first panel discussion, we delved into the necessity of creating robust policies and frameworks to support mental health in workplaces. As discussed, several organizations are already incorporating mental health support into their operational policies. But the need for scalability and inclusion remains paramount. The key points from this session was, first of all, the scale of problem was discussed. And it was mentioned that the prevalence rates of stress are very high across the organized sectors and also the unorganized sectors. And it was also mentioned that not only the corporates, the private industries, but also the stress in government institutions should also be looked into, including as mentioned by DGHS, that all the healthcare providers, the kind of mental stress that they have to go through in their day-to-day functioning also needs to be looked into by all of us. And then the key factors that were related to the stress at work was mentioned. And it was mentioned that work style, hours, role conflict, role demands, career progression, work-life balance, organizational support, all these are factors which are affecting and creating the stress at work. Some of the potential solutions which has come out after deliberations by the group includes making provision of health and safe workplace a mandate for all organizations. The panel deliberated and they came out with the conclusion that it is very important to provide safe working conditions, and this has to be given priority. And for that, the global policy also mandates that for companies to enforce such stable, safe working conditions. The panel also discusses about the task of creating awareness among the employers and the employees about various kind of mental issues that they are facing, so that an early intervention can be taken and these issues can be resolved at a very earlier stage. It was talked about the employee resilience and skill building, and it was deliberated that development of communication skills, coping with stress, in addition to awareness and providing first aid training to employees can be considered. In this respect, in fact, one of the discussions point was also about how we are, as a society, we are growing, our next generation, how they are being grown up, and what is the kind of resilience that they are incorporating. So that also was discussed, and it was also emphasized that the upbringing of the next generation, the kind of resilience that they should have, the kind of stress resilience and how to handle the stress should also come, and it has to be taught even from the family itself. The panel also discussed various interventions that talk about bringing a sense of well-being, a sense of belonging, and community-level activities like group events which are not lost, which can also be helpful, as was discussed, the professional interactions, the professional cohesion, that is also important for ensuring that the stress at the workplace can be reduced and the feeling of togetherness can be enforced. Nimaz talked about the various tools which they have developed for reducing the workplace stress, and it was discussed that these tools need to be scaled up for addressing workplace stress. The panel finally deliberated and they came to the conclusion that mental health problems needs to be addressed, but how exactly this needs to be done, integrated in the workflows, needs to be discussed. And more evidence needs to be generated on quantifying the productivity implications for organizations. The role of Tele-MANAS in ensuring that the mental health services are provided to the unreachable population was also discussed, and the efforts of the Ministry of Health and Family Welfare in this regard was also lauded by all the panelists. This panel 2. Okay. The second panel discussed around the second panel discussion addressed mental health challenges in informal workplaces, such as those in the gig economy, daily wage laborers, and migrant workers. This discussion highlighted the unique challenges faced by these groups, such as lack of access to formal mental health practices, social stigma associated with mental health issues, which prevents workers from seeking help, innovative approaches such as leveraging the Ayushman Arogya Mandirs and Tele-MANAS to reach these vulnerable populations. The points of discussion that came out from this panel discussion was that the informal sector, which comprises 80% of the Indian workforce, still faces multiple challenges such as poverty, debt, and lack of health services. Many of the panelists were of the view that the mental health is at the very bottom of their priority, and their other livelihood issues has more prominence in their lives. Mental health care must address these issues and must be integrated with the physical health. Then there were challenges of integration which was addressed, and mental health services such as Tele-MANAS, which is not fully integrated into the programs like Ayushman Bharat, was discussed. In this respect, the panel feels that civil society can play a key role in raising awareness and connecting workers to services. Labor policies and registrations and labor laws and platforms like eShram was discussed, and it was discussed that these portals aims to provide security, but their impact on informal workers is limited due to weak implementation and low participation. The role of civil society was discussed, and civil society organizations can, like Jan Sahas, they have mentioned that they help the linking the informal workers to government schemes, particularly for migrant laborers who often face exploitation and lack access to mental health care. Preventive approaches were discussed, where it was the entire panel was of the unanimous view that prevention and awareness are essential. Initiatives like Tele-MANAS and Ayushman Arogya Mandir wellness packages, including yoga, are valuable, but stigma and access issues still persist. There are barriers to access where there is a severe lack of mental health services for informal workers, particularly for severe conditions. Increasing mental health literacy and equitable access is critical, as was discussed by the group. The group came out with various recommendations, which includes integrating the mental health with the overall health services provided by various primary, secondary, and the tertiary sector, like in the case of Ayushman Bharat, and addressing various social factors like poverty and migration to resolve the mental health issues of informal workers. The civil society and government collaboration was discussed, and a consensus is reached out that both has to collaborate to ensure last mile access to mental health services, and utilizing platforms like eShram, where all the data of informal workers are being collected, can be utilized by both government as well as civil societies to consolidate this collaboration. Skilling programs also, that was in fact one of the very good point that has come out, that a lot of informal workers are being registered in various skilling programs. So if the mental health can be added as one of the component in these skilling programs, this will help the workers to detect their mental health issues at a very early stage so that it can be addressed properly. The resource centers, dedicated resource centers should be established for providing mental health support, legal aid, and access to services for migrant workers. And there is a need was felt for a cross-ministry collaboration where all the ministries have to work together to develop policies that ensure mental health is a key part of worker welfare initiatives. The final panel focused on preventive mental health and the role of holistic practices in maintaining well-being. We learned about the benefits of integrating indigenous knowledge, yoga, meditation, and other holistic approaches into daily routines. These practices are not only effective for individuals, but can also be incorporated into workplace wellness programs. The panel emphasized the shift to be taken from treatment to prevention with a focus on early intervention. Ayushman Arogya Mandirs can be positioned as key venues for promoting these preventive mental health practices at the grassroots level. The panel discussed about a large number of employees are going through the stress, and there is a need for having a work-life balance. The gender stereotyping has to be addressed, and there is a need to ensure that the safety at workplace should be ensured through job security, as well as to ensure that the employees are properly relaxed in terms of the HR policies. They should not be, there has to be a proper leave management system so that when they are on leave, they should not be disturbed. The working hours should be fixed so that the employees can go back to their homes, relax, and there should not be any kind of intervention or disturbance from the employers during that time. The majority of the employees, it was mentioned that even after COVID and even after a lot of awareness programs, even the majority of employees do not share about their mental health at workplace due to the stigma attached. And a Deloitte survey was quoted where it was mentioned that the financial implications due to the mental stress at workplace cost around $14 billion for India. Resources for mental health are limited and not available, and challenges that we face are the resources, from where these resources and when these resources are needed for mental health care. The panel comes out with the recommendations that the vulnerabilities have to be recognized and cross-cutting factors like gender, socioeconomic status, education, age should be recognized. The recommendations given by the panel includes creating a safe workplace by proper HR practices where discrimination, harassment, sexual harassment at workplaces, violence at workplaces can be dealt with penalties and measures. Worker rights needs to be valued. Leaders to model the right behaviors, as was mentioned. Our role models, the leaders should also practice what they preach. So that is very essential because the society looks into them and they adopt those behaviors. The leaders should identify and address the real issues contributing to workplace stress, and interventions around the inclusivity opportunities to discuss appraisals was also mentioned during the panel discussion. A lot of emphasis was created about creating of awareness of employees and employers and recognizing how each one of us is contributing to the workplace culture. It was mentioned that it is not just yoga and wellness which should be integrated into the workplace, but yoga and wellness should be integrated into our whole life. The panel discussed about the psychosocial interventions where simple therapies can be provided to people in the community. Dr. Sitoya mentioned about the friendship bench for simple problem-solving techniques. Physical activities should be promoted in the workplaces in any form, which can also reduce stress to a significant extent. And the HR policies and the employer should support workers with mental health conditions, because through studies it was found that 20% of people will have experienced depression in lifetime, and they need systems to support and accept them even after recovery. It is very important to ensure that there has to be a work-life balance, work-life integration, and not only mental health, but physical, emotional components as well as needs to be addressed. Throughout today's discussion, one theme stood out: the remarkable success of Tele-MANAS, with over 14 lakh calls handled in the last 2 years. Tele-MANAS has become a lifeline for millions of Indians seeking mental health support. The launch of the Tele-MANAS app and the video calling features today marks a significant step forward in extending this support even further. By providing 24/7 confidential access to mental health professionals, the app and video calling features will ensure that help is available to everyone, anywhere and anytime. Looking ahead, we will ensure that Tele-MANAS will expand its reach, particularly in informal workplaces, as came out during the panel discussions, where workers may not have the same level of access to mental health resources. This is where digital platforms like Tele-MANAS can play a transformative role in making mental health support more inclusive. As we continue to explore ways to make workplaces mentally healthy, the discussions today have shown the importance of integrating mental health support into organizational policies. But the responsibility does not lie with organizations alone. Leadership plays a critical role in shaping the work culture, and it is imperative that the leaders demonstrate a commitment to mental health. Promoting a supportive work environment will not only improve employees' well-being, but also boost productivity and engagement. Moving forward, there is a clear need to scale up successful policies from today's discussion and apply them across both formal and informal sectors. The role of holistic practices in preventing mental health issues was a key highlight of today's discussion. Practices like yoga, meditation, and other indigenous techniques should not be seen as supplementary, but rather as integral to maintaining mental well-being, particularly in high-stress working conditions. We need to focus more on prevention and early intervention, ensuring that mental health becomes a priority at all stages of life and work. The Ayushman Arogya Mandir are well positioned to promote these holistic practices, and the challenge now is to ensure their effective integration into the workplace wellness programs. The way forward, as came out during the discussions, is, first of all, scaling Tele-MANAS. From the ministry side, we must continue to expand Tele-MANAS, ensuring that it becomes a cornerstone of mental health support, particularly for those in the rural and informal sectors. The integration of telehealth into broader mental health strategies will be crucial for reaching the last mile. Workplace policies, organizations must adopt inclusive mental health policies that cover all employees, especially vulnerable groups such as gig workers, differently abled individuals, and gender minorities. Leadership training should be prioritized to foster empathetic and mentally healthy work environments. Preventive care and holistic practices. We must focus on preventive mental health by incorporating holistic practices into workplace wellness programs. This includes scaling initiatives through Ayushman Arogya Mandirs and other local healthcare platforms to ensure that mental health care is accessible at all levels. Collaborative approach is needed, and it is essential to encourage multi-stakeholder collaboration between government, healthcare institutions, civil society, and the private sector to build a comprehensive mental health ecosystem that supports both formal and informal workers across the country. In conclusions, today's discussion have set the stage for actionable steps towards a future where mental health is prioritized at every workplace, formal or informal, urban or rural. As we move forward, let us carry the spirit of today's dialogue into our policies, programs, and workplaces, ensuring that mental health becomes a collective priority for all of us. I would like to thank you all once again, and I would look forward to continuing this journey with all of you. Thank you.
Thank you, sir. I'd now like to invite Dr. Neha Garg, Director at the National Health Mission, to deliver the vote of thanks.
As we wrap up our event for the day, I would like to deviate a little from what we call a formal proposal of vote of thanks and rather call it expressing my gratitude for the day. So please bear with me as I stand between you and a sumptuous lunch. My gratitude is first due to the leadership of the Ministry of Health and Family Welfare, especially Ms. Aradhana Patnaik, Additional Secretary and Mission Director, for her vision and motivation. Ma'am's wide experience and her special interest in the cause of adolescent mental health was invaluable in shaping today's program. A very special thanks to my boss in the workplace, Joint Secretary Policy, Shri Saurabh Jain. With his positive nature, balanced approach, and nuanced guidance, Sir led the team to bring this event to fruition. My heartfelt thanks to all the session chairs, Dr. Atul Goyal, Dr. Pratima Murthy, and Major General Professor Atul Kotwal, and all our panelists. Your experiences and solutions have helped us see that mental health is a shared responsibility, not just an individual issue. The engaging discussions of today have generated enough food for thought and learnings that we take back with us to translate into action points. My thanks are due to all delegates who joined us in person or online. Your engagement has been invaluable. Now to the people who make it happen, the dynamic Tele-MANAS family. A big round of applause for Nimhan's team, led by Director Dr. Pratima Murthy, Dr. Naveen, Dr. Swati, please. The IIITB team, led by Dr. Shrikant, the NHSRC team, led by the Executive Director, Dr. Kotwal, and of course, the Mental Health Division at the Ministry. Thanks are also due to Dr. Seema from Nimhans, who worked on the booklet, Taking Charge of Your Mental Health, and made it possible in a record time. She could not join us today as she is not well. My thanks are also due to the WHO team, country office, CRO, as well as the headquarter for working on the Tele-MANAS assessment and the report. We are grateful to the print and digital media for covering today's event and helping to spread our message. A big thank you to the PATH team, led by Dr. Neeraj, Dr. Swati, Dr. Rachna, Dr. Ajay, Dr. Bhushan, Dr. Abhishek, and all others whose name I may have missed. Your exceptional support in the technical and operational aspects of this event has been crucial, but more importantly, your positive and prompt approach has been unprecedented and the basis of this successful program. We appreciate your partnership. Thanks to Anhad, who beautifully held together today's program as the anchor. I also want to give a shout out to Ms. Anika Singh from Voice and her team, who literally burnt the midnight oil yesterday, working on a special part of today's program. Last but not the least, my thanks to our mental health team at the Ministry. We are a small team, but we come through every time. Your hard work and going beyond the call of duty is well appreciated. A big round of applause for Ms. Rajni, Ms. Rujuta, Ms. Prachi, Ms. Shruti, Mr. Manoj, Mr. Manish, Mr. Shashank, Mr. Ajay, Mr. Murari, and everyone else. Finally, thanks to the events team and hospitality extended by Le Meridian. My sincerest apologies to anyone whose name I may have missed, but our gratitude flows to you as well. Thank you all for your participation and commitment to this important cause. Together, we can make a difference. I now request all of you to join us for a lunch before we disperse. Thank you very much.
Thank you, everyone. Have a good afternoon. Please join us for lunch and to continue these discussions on your left and my right.